Welcome to the Tuesday, November 17th, 2020 meeting of the Reno County Commission. I call the meeting to order. Our first order of business today is the Pledge of Allegiance to the American flag. Would you stand with me, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We discontinued having prayers at the first of the meeting due to the COVID event, not wanting ministers to come with us. It was suggested that we move back to that. So today, via phone, I've asked Keith Neal, youth pastor of First Presbyterian Church, to lead us in prayer. Neal, Keith, are you there?
I am indeed.
Okay, please proceed.
Okay, let us pray. Dear God, thank you for the many blessings that we have in our local community. And help us all to stand together through the challenges that we are facing today. I pray for those who govern in this community and county, that they make wise and godly decisions, which are always in the best interests of the community. There are so many people who are struggling during this time, from those on the front lines fighting COVID-19, to those struggling just to survive, and to leadership wrestling about making the right decisions. So strengthen them, Lord. Give them wisdom. Give them discernment and grace for the heavy burdens they carry and the decisions that have to be made. I pray that you will help everyone in this meeting today to cultivate the kind of city and world of which you dream. A city and a world where everyone flourishes, is respected, feels valued, and where God's peace and love is found. And we pray all this in Jesus' name. Amen.
Amen. Thank you, Keith, for being with us today. We appreciate your involvement.
Pleasure.
Thank you.
God bless.
Welcome to our meeting. I have no announcements today before we move on, but we do have many people from the community with us today that want to be held or heard, and I believe most of them are probably involved in our health discussion. The way I'd like this to go, please, is we will hear from our interim health officer, Karen Hammersmith, and Emergency Management Director Adam Weishauer. I'll then recognize public comment as it relates to public health, as many of the comments may be related to the report from our health officials. Each person requesting to speak will be allowed no more than 5 minutes each to speak. At the conclusion of those comments, commissioners can then consider any action or actions they'd like to take in response. We do have members of our medical group that assists the county with us today, and then also we have members from the hospital here to speak to us afterwards, after Karen's direction, so we'll have them first and then move on to others from the community. With that, Karen, would you please make your weekly report?
Thank you. As of now, which is today, I looked on the dashboard, we have 3,647, there's an echo there, total community, not just community cases, total cases from our first case that was back in March. We have 1,105 active cases, 816 community active cases. We have a 14-day positive test rate from November the 11th of 40.3%. We have a 14-day new case count of 768 from November the 11th. We have had 33 deaths from COVID-19. We have had 23 deaths in the last 30 days. We have 40 clusters Active cases in our long-term care facilities are 48. We have 9 deaths contributed to long-term care. Correctional facility, we have 326 active cases. We have had 2 deaths associated with the correctional facility. With the amount of community problems that we're having, I am putting in a health order 20-04 to restrict limiting gatherings to 10 people. This is so that our community can get back to where we want to go. We want to be prosperous. We want to have our community open. We're looking across what other cities and governments are doing, and that's restricting, but not shutting down. So the limit is so that people can get in smaller gatherings of 10. Social distancing is required by 6 feet so that you can really do the safest things that we know how. We are following the governor's mask order. There is guidance in this order for businesses so that they can require their people coming in, their employees, as well as retail shoppers to wear masks and support that. It is supported by our health order. We really need to get the numbers down. Our hospital is completely overwhelmed. We have approximately 34 to 40 patients in the hospital at all times. We've talked about how the nurses are completely overwhelmed, the physicians are overwhelmed. Alone, we had 3 cases come in yesterday that had died. It's very sad. So for that reason, I'm putting in this health order. We will revisit this in 30 days so that if the health order can be lifted at that time or updated so we can have less restrictions. But it is the goal so that we can get this positive test rate down, the community cases down, and get our hospital less overwhelmed.
Okay, thank you, Karen. Adam, is Adam here today?
Adam is at home. His child's in quarantine, so he's at home working.
So we'll not have that. Okay, going on to Dr. Polly as part of the
Well, can I
health
ask
team.
Karen a couple of questions, please?
You may certainly ask questions. Our discussion of the commission will be after all people speak to us from the community today.
Well, as we put on an order, I would like to ask, are you an elected official?
No,
Okay. Are you a medical doctor, PhD, epidemiologist, virologist, or economist?
no, I'm a registered nurse.
We've seen a real escalation in cases and deaths, agreed?
Mm-hmm.
Has that occurred while mask mandates and limitations have gone on through that time period?
So these have occurred and continue to occur, but I cannot say that in Reno County that people are adhering to the guidelines that we have put in place.
So you're saying it's the people's fault?
No, I'm saying that we have to do everything that we can do. Wearing a mask is the simplest thing that we can do. We do not have a vaccine, and so we are doing everything that we can so that people understand. So it's educating everybody what we're doing.
Do you deviate from the Kansas Department of Health and Environment recommendations in any way?
Not that I know of.
And you feel like you're optimizing everybody's outpatient opportunities, such as, and that probably would come more to Dr. Pauly, hydroxychloroquine, there's varying studies on that. Through the state, we've made that unavailable. Nebulized steroids through a theoretical issue of not wanting to nebulize anything, we've ruled that out. You're telling us these are desperate times, right?
These are desperate times. I'm not going to speak to the actual treatment because I'm not a physician.
Agreed. Okay, well, very good. Well, one question. Backing up, I received this at 9 p.m. last night. I hadn't heard a single word about it before that. Can you shed any light on that, on your timing of how this began to develop and how it developed, who worked with you on it? and how at least one county commissioner didn't know anything about it until literally 12 hours ago?
So I have been working on the order. I am working constantly. I had over 200 emails yesterday come in. That is not just anecdotal. I am working 24/7 pretty much. And so that's when I could sit down and make a thoughtful email and send that to you.
Dr. Stefan, maybe I can interject a little here to help the whole thing out. Is that yesterday I was informed that the health order might be forthcoming.
When?
Yesterday morning. I was here from 7:30 to about 2:15 yesterday afternoon, trying to work with emails and answering them and so forth. And so a little before noon, the health department had this put together for them. And so I reviewed it with Karen and had some things in there I didn't quite think were right. And so Karen and I worked together and we finished this up, 2 o'clock, 1:30, something like that yesterday afternoon on wording that I thought was more appropriate in my layman's knowledge than what was put together to allow some, rather than prohibitions, to allow some leeway and to also support our business entities so that they felt that they were given some direction. And I'm going to later on comment about some statements that the RCERT, one statement that the RCERT put together that I completely disagree with, and I'll cover that in a little while. But this is why I didn't get the revised copy until yesterday late afternoon myself.
Well, you know, it's very clear that the Reno County Republican Party and the committee men and committee women wanted to extend to you the expertise of a medical doctor with a whole lot of business experience. And clearly, you've chosen not to take advantage of that experience, and that troubles me a lot. And particularly,
I think, Doctor, that...
with all due respect, you know, you're not a medical doctor, and I would have been happy.
I did not even consider any medical part to this.
Yeah, and I would have been happy to have participated in this. You know, Prairie Star Health Center has worked hard to move Dr. Deanna Marshall in to help you as well. Did you get hold of her at any point in this?
I have not reached out to her yet.
And I know Dr. Brock Wells has made himself available to you all at any point in time. Did he participate in this at all?
No, he is a doctor of chiropractor, and I've been working with the family practice doctor. I've been working with the hospital. I speak to pulmonologists and pediatricians.
We have utilized...
Karen has been working with the people that the other two commissioners at this point recognize as being professionals in this area.
Well, your field of view is too narrow. You're not representing the entire community with your experts. And we've made available other experts, including myself, and to not take advantage of those to represent the entire community when we have a registered nurse creating mandates.
There's not a mandate in here, sir.
It's a health order, same thing.
We'll move along.
This is a problem.
I think we'll move along. I think the chairman has the ability to move the agenda along as in the best interest of the county, so we'll move along. Dr. Polly, do you have any comments this morning?
I think Karen's explanations of the numbers are correct and a good reminder of the trajectory of this.
We're only going to allow 5 minutes for any speaker from now on. Excuse me for not saying that.
No problem. I will say our outpatient trends for influenza-like illnesses from the 1st to the 8th has surpassed that 40% positive test rate, if that gives you an idea of the prevalence of COVID within those with any symptoms ranging from runny nose to shortness of breath, cough, diarrhea, etc. Our volume of outpatient visits with these symptoms has increased drastically in the range of 600 patients per week. I say that because this tends to be the lead data of which the lag data follows. So if that remains true, which it has for the duration of this pandemic so far, our inpatient numbers will continue to trend up. I'm relatively confident in saying that at least for 2 weeks from this point. After that, it's yet to be determined. I hope things do crest at some point. With that, I'll leave it for questions. Otherwise, I think we should prioritize the conversation from the hospital.
Okay, thank you, Dr. Polly. Is there any questions, Dr. Polly? Thank you for being here today. At this point in time, I'd like to ask the people from our regional hospital to come in. President and CEO Ken Johnson, Dr. Degner, who's been working with the health department constantly, and Chuck Welch are here today to do a presentation. Welcome, Ken. Welcome, Doctor. Welcome, Mr. Welch. Ken,
Well, good morning.
please introduce yourself
I
and
will
your
do that.
position.
Yes.
And as we're limiting conversations today to 5 minutes, please.
Okay, very good. I'm Ken Johnson. I'm CEO of Hutchin Regional Healthcare System, and I'm joined by Chuck Welch, who is the Vice President of Marketing and Business Development, and also Dr. Rex Degner, who wears many hats actually in our organization, CMO. Actually is one of our board members, and he's a pathologist, practicing physician here in town. I appreciate your service to our community. Thank you for inviting me in. Just thought I'd take a few minutes just to brief you on the status of patients and staffing in the hospital. As we have been tracking this really just recently, and as you all know, we've all been dealing with pandemics since January, February. But since October 1st, we have seen a significant increase in the number of COVID patients. We've gone from an average of 5 to 35. Today we have 34. Transfers, we have not been able to keep all of our community members and those that come to us for care in our organization. We've seen an average of 2 transfers a day to up to 5. Vented COVID patients and vented patients, on October 1st, we actually had 0. But we have seen that increase significantly to up to 5. Today we have 2. And then our average daily census has gone from about 60 to about 90, and today our census is 79. One of the things that we're faced with is staffing, and you've heard about staffing challenges. We actually have 45 members of our hospital staff that are out sick, and that's about 5% of our workforce.
I'm sorry, I missed that. Apology. What?
About 45 of our staff members are out sick, which is about 5% of our workforce at the hospital. So not only are we challenged with the natural staffing of very busy patients that are in our ICU and in our 2 COVID units. We actually had to open up a second COVID unit. But we also have staff members that are out sick, and a lot of those are clinical staff members. And so we are working to transition staff within the hospital. That has been an excellent example of teamwork and breaking down the clinical components of care. And we have ancillary departments that are stepping up and helping take care of very sick patients. And we have also limited the number of imperative surgeries and procedures that we've done. We always have a team available for emergent procedures and emergency surgeries, but we have been able to and have asked our physician community to limit those surgeries to those ones that are imperative, so that we could redeploy CRNAs and other staff members to other areas of the hospital, ICU, ED, and on the floors to help take care of very sick patients. As I have been in contact with my colleagues in Wichita, Salina, Hayes, Newton, McPherson, we are all dealing with kind of these same issues. I happened to be invited to attend a call with Senator Moran the other day and some area CEOs, and we are all kind of faced with some of these same challenges. Wichita, a lot of times, has been a backstop for us, but today that is not available, and the resources in Wichita are also very depleted, and that's been well documented in the news. So again, just appreciate the support of the community for safe practices, appreciate the support that we've received in the well wishes and the thoughts and prayers, and there's a lot that's happening. A lot of good things are happening within the medical center and within the healthcare community, but our physicians, our clinicians, our staff members are getting weary, and we're asking for commitment for safe practices and a healthy respect for the seriousness of the disease. So,
Okay.
Thank you very much.
Thank you. Are there any questions of Mr. Johnson? Mr. Welch or Dr. Degner, either one of you might want to make comments at this time. So please do. Dr. Rex Degner has worked with the health department since the start of COVID and has helped our health department immensely. I thank you for that.
Absolutely, and I just want to say this community has been blessed with 4 board-certified pulmonologists we've had on board that have been keeping up to date on the very latest treatments out there. We're just bringing in the ability to bring the new monoclonal antibodies that are coming off experimental use. 3 of our pulmonologists are recently trained, close contact with their colleagues at Mayo, Johns Hopkins, everywhere else, on a weekly, sometimes daily basis on the latest and greatest in what is ever changing in the treatment of this. So I want to stress to the community that we do have excellent services here, are taking well care of our patients. Yes, we're stressed thin, but we're working hard and taking care of business. If we can tap the brakes a little bit and keep our numbers no higher than they are, then we'll get through this, but appreciate the support from the community.
I've got a couple of questions.
Sure.
It relates to the Kansas COVID website and hospital admissions and stuff. I don't know how close you follow that, but you guys may be able to tie it into to real hard numbers that we're seeing at our hospital. They talk about on the hospital capacity side, it says ICU, or total staffed ICU beds, and this is the entire state of Kansas, is 719. It says 427 of them are used by all patients, 163 of them by COVID-19 patients, which leaves 41% of the staffed ICU beds in the state available. Any comments in regards to that, or where your percentages fall?
So you want to let you chime in on that?
Yeah, so ask the last part of that. Ken was talking to me.
Can you re-ask the last part?
Sure.
State your name and so forth.
Sorry, Chuck Welch, Vice President for the Hutchinson Health System. Also the Business Development Director. Among other things, I'm also a registered respiratory therapist with a degree in cardiopulmonary science as well. So,
Well, on the governor's COVID website, it says total staffed ICU beds are 719. And that was yesterday at 12:30. And ICU beds used by all patients is 427. ICU beds used by COVID-19 patients is 163. So it leaves 41% of ICU beds available. Those are real hard, clear, tangible numbers. Can you guys fill in the blanks on those for our hospital?
sure. So our hospital is blessed to have 18 ICU beds. 4 of those we call it the Q, and they're isolation reverse pressure rooms that we can put COVID patients into. 2 weeks ago, along with our COVID ward up on the 5th floor, we had 41 patients, COVID positive patients. So that was 63% of our entire hospital population was COVID patients. Now, we try not to put all of those patients in the ICU. We try to reserve some for medical or trauma or something like that, but unfortunately, these folks are coming in sicker. We're seeing a lot more of them, and they're coming in further down the road.
Can you hit me with percentages on, how many ICU beds? You have 18. How many of them are full right now?
So we have currently 2 ventilators going in the ICU right now. We have 34 patients in the hospital, probably half of those beds.
Half of the ICU beds
Yeah.
are available. Okay. Okay.
But that changes from hour to hour?
Sure, you bet, you bet. And then again, theirs is just a snapshot in time as well. It's
Yeah.
kind of interesting when you look at it, 'cause you really do see across time, about this 40 to 50% of beds are still available, and 2 out of 3 patients or even up to 4 out of 5 are not COVID patients. So I think we're kind of going to that talking in generalities, and we're trying to impress upon people more we're in a tight spot. But people need to know the numbers. They need to see if there's 18 ICU beds and 9 of them are available. That doesn't mean people are going to go be out of control and expose themselves. Nobody wants to get this. So, I really do, again, I said this last week, we're missing that component of just being informative. Our voters, our citizens, they like to be informed. They want to know what the real numbers free of emotion are. So don't forget to throw that aspect of it in, please.
And I'd like to add, we have a hard number of 18 ICU beds. That doesn't mean that we've, through this period, been able to staff all 18 beds.
Right.
We've had to stop elective surgeries or limit them so we can go down to 4 ORs, so we can free up those nurses to go to other floors in order to fully staff those ICU beds. We have been very close to ICU diversion in the past several weeks because not all 18 beds were full, but we don't have the nursing staff that's trained. We've limited the OR so we can take some CRNAs, very highly trained specialists, to work in our ICU because they have the skill to run drips, to do vents, to do the whole thing. So there's a little dichotomy there between the number of beds physically available and the ability to staff them.
Well, right.
And that's been very difficult.
And that's why on this website, they are staffed ICU beds, is how it's defined.
Yeah.
So,
So for us, staffed ICU beds would be 12.
Okay. Okay.
Thank you. Great questions.
Thank you.
Okay, the next speaker that we'll bring in, it will be Deborah Tufel, Executive Director of the Reno County Chamber of Commerce. She's available. Deborah, please come to the podium, state your name and address, and you have up to 5 minutes to give a presentation to the commission.
Good morning, Commissioners. Thanks for allowing me to speak this morning. My name is Deborah Tufel with the Hutchinson-Reno County Chamber of Commerce. As you all know, the Chamber has been on the front lines of helping our business fight COVID from the very beginning. I'll recall back in April when we sat down with former Commissioner Bob Bush and Health Director Nick Baldetti. At their request, we formed a task force to focus on the economic recovery aspects of COVID. And that task force was called the Reno County Economic Recovery Task Force. It was convened as needed to work with the health department and the county on important decisions impacting businesses, and we convene it from time to time in critical moments. Last week was one of those critical moments. We met on Wednesday, and we heard from the members of the RCERT about the impacts that this virus is having on them. We also heard a report from our health department. And what we heard is many businesses are being impacted by the quarantines and the positive cases that are causing absenteeism in our businesses. This is becoming an economic issue because businesses are being hampered by this virus. The vast majority of the participants on the RCERT call agreed that we need more extreme measures to stem the spread of this virus. You've heard from our hospital, and even on that call last week, our hospital was being hindered by staff absenteeism because of quarantines and positive cases. Last week, I think the number was 26 were out. This week, it's up to 45 as of yesterday. I'd like to read for you a testimony from one local business and their perspective. This is from Myra Kitson with Metropolitan Coffee. As a small local business committed to our staff and customer safety and to the quality of our community life, we have been enforcing the mask mandate in our stores since it was put in place. Because there is so little compliance across the community, our staff have had to endure multiple encounters with angry and sneering potential customers that say, "Why here? No one else requires them." We require them because we care. At this moment, we have had to scale our 2 locations back to 1 because a staff member tested positive and not from exposure at our business. However, at this point, no other staff have developed symptoms nor tested positive, and we believe that is due to the fact that our staff wear masks on duty at all times. The ramifications of each closure are vast. Staff will not get paid, we only have so much savings, and we cannot make rent and utility payments without income. We need to get the community spread under control, and we believe that requiring masks to be worn will have a major impact on reducing spread. Please help our small business survive and keep the community we love safe. Wear a mask. Signed, Myra Kitson, Metropolitan Coffee. I hear stories like this every day. Absenteeism because of this virus is becoming an economic issue. The impacts are real, and the non-compliance with masks and the failure to self-monitor is hurting businesses from downtown on Main Street to industrial businesses in our community and even our hospital. So I'm here today to simply ask you to support our Reno County Health Officer and the request that she has today in front of you, that we continue the mask mandate and that we look at other measures for mass gatherings. We don't think these measures are going to hinder business. We think that it's actually going to be a help, because we have to get this virus under control for ourselves and for our community. We also have 2 members of the RCERT here today. They heard what was shared at that meeting last week, and they took it upon themselves to get active in the community to try to gauge what the rest of us are feeling. So I will cede the floor to them for the rest of this presentation, but ask that you respectfully pass this mandate that's being asked of our health officer today.
Okay, and who are you asking to speak for 5 minutes at this point?
For 5 minutes, we have Mimi Meredith with the Cosmosphere and Aubrey Patterson with Hutchinson Community Foundation.
Yeah, I would like to temper that discussion with my statement that after your meeting where you had a push to email the commissioners, I ultimately probably had a 10-to-1 email response from business owners, small business owners, who did not want further mandates and did not want mask mandates. So I did not see that you're representing the majority of the small businesses in the county, and I think you represent the vocal minority.
Response?
I thank you for sharing that. I didn't get any emails to that effect. I think Mimi will share the numbers of people who supported the petition that they distributed, and maybe I'm not hearing from those same businesses that you are, Dr. Steffen, but I thank you for sharing that.
And we'd be glad.
Please introduce yourself.
I'm Mimi Meredith, and good morning to the commissioners and to the staff.
Are you a member of this committee that they were just talking about?
I am a member of the Chamber Board of Directors, and therefore I do attend the RCERT meetings, and I also am employed by the Cosmosphere. And today I'm here to first of all recognize and say with a very grateful heart, thank you to the people who are in the front lines of this every day. You know, I've been trying to rack my brain to think, when in my lifetime have we ever seen anything like this before? When have we ever been called on to do something that really is for the greater good and on any big level? And all I could come up with was, well, there was the energy crisis in the 70s, and I remember we were encouraged to lower our thermostats and to save gasoline, and then that's when the 55-mile-an-hour speed limit was imposed. And I remember not everybody complying or wanting to do that, but I don't remember this much upheaval over that. And then the only other thing I could think of was water restrictions during a drought, when you have to maybe go every other day with watering your lawn. That's not a lot of sacrifice. Then there was my parents' generation, and my father fought in World War II. And my mother had a ration coupon book for 3 years, not just a few months, that they were severely impacted in their quality of life. My great-grandfather fought in World War I. So I just don't feel like I'm being asked to suffer on any great level by looking out for the greater good. And I know that in all of those things I just mentioned, there were opposing views. There are always opposing views. Thank goodness we live in a country where you can receive emails from both sides. But never before have we surrendered our leadership to the contrarian, to the conspiracy theorist, just because of political pressure. Never before have we allowed this kind of harm, and Deborah's remarks are the icing on the cake. Think of the businesses in this community that have already closed this year and cite COVID-19 as the reason. Look to the Cosmosphere that lost $2 million in revenue this year because of this pandemic. And think what will happen to the greatest space museum in the world if we don't take some kind of action to stem the tide in our county. Think what has happened to school children. Can you imagine this? It's like the push me, pull you in Dr. Dolittle. Are we in or are we out? And parents learning week to week what kind of situation they'll have that then impacts their ability to get to work, to raise the money that provides for the basic essentials for those children who are not getting the best education they can this year, and we know that. And then, ironically, look to what's happening for the professionals who care for us. Look at their exhausted state. So we know that we can flatten the curve. Yeah, 9 community members got together and drafted a petition, and I sent those comments on to you so you could hear the voices. And yes, some of us are here today, but there are thousands more who are waiting to hear what you will do as far as leaders to support the people who are charged with public health and safeguarding all of us. Thank you.
Okay, Aubrey Patterson, please.
Mimi, there's 2 or 3 of us in here who went through the polio episode in the 50s.
Oh, that's a good one. I wasn't.
Good morning.
Aubrey, introduce yourself, please.
Yes, I'm Aubrey Abbott Patterson. I am the CEO of the Hutchinson Community Foundation. I'm also a member of the RCERT, and I did help draft the petition. As our Board of Public Health, it is important for you to implement public health standards for the safety of our communities. One of the best ways to do that, I believe, is to support our medical professionals and our health department professionals and the recommendations that they are making to us. The 1,200 plus people who signed an online petition are asking you to set an example and provide the leadership we all need to make tough decisions about the way we lead our lives in the next few months. I think we have some hope on the horizon. We have a vaccine. It'll be rolled out over the next few months. If we can buckle down and do what we need to do to take care of ourselves and our community between now and then, we might see a different outcome than if we don't. Our government has done these things in many ways. Mimi spoke to some of them: seatbelts, helmets, food safety, truancy laws, smoking indoor bans, safe and sane fireworks, burn bans on windy days. These things come to us from national, state, and local government. I think what a health order like this one does is gives us a guardrail and a speed limit. Just like on the road, I might choose not to follow the speed limit. I might be more cautious or less cautious. And Commissioner Stephan, you spoke to the businesses who are saying, I don't want a mask mandate. I don't want to have to enforce that, or I'm not going to enforce that. I think we will see that with this health order too. But we will have the guardrails in place. And like a speed limit, what I know is that whether I decide to follow the speed limit or not, the speed limit's there based on what someone who's qualified and has studied the issue over time tells me is an appropriate speed limit. At this point in the pandemic, what I'm seeing and what I'm feeling myself is decision fatigue. That as a mom and a woman and an employer living in this community, I'm making decisions every day that are difficult for myself, my kids, my family, my employees, and I'm tired of making those decisions, and I'd like that guardrail up there to help guide me and honestly to give me a little courage that I'm making the right decisions. For me, it's, will I allow my kids to hang out with their friends? Will I allow them to go to the gym, indoors or out? Will I stop at the brewery? Things like that. Those are personal decisions and for my family. Will I host Thanksgiving in my house? How will I explain that to my relatives if I don't? Will I work from home? Will I encourage my employees to do the same? Will I enforce masks in my workplace? That's a really hard thing to do. But if our county health officer and other medical professionals are saying masks work, social distancing works, that makes it a lot easier for me to say, ma'am, will you pull your mask up? Or we wear masks in here, we'd invite you to do so also. If I don't want to do that, I don't have to, but it certainly gives me something to stand behind. And I think that's, when you read the comments from people in that petition, and I hope you all did read at least some of them, there were over 300 comments, that's what people are begging for. They're begging for you to set an example and provide the leadership we need and to stand behind the health orders of our medical professionals and help us know how to respond to this in the coming months and in our individual lives every day. Thank you.
Thank you. I'd like to make one little short conversation with the ladies.
Aubrey, or which one do you want to ask a question to?
Well, I think probably all three of them. Maybe I'm not really a question, it's more of a comment, okay? I read your letter, and we visited about the letter on November 11th of this year, and I did take exception to one comment, and it was item D, the last sentence in that structure. I took real exception to that. It cannot happen unless our county commission makes it their business to ensure the public well-being. You know, we don't do that. People do that. I think maybe a little education course in county government might be worthwhile to know what our Reno County, our county government can do under the state statutes of the state of Kansas. Government, and a breaking news flash for everybody, government cannot solve the increase in COVID positives. It's up to each one of us, you and me. We are limited what we can do. We've done about everything we can do to help this. And so I just want you to, I'm not being overcritical because we work together well, but I just want you to take time to realize what the county government can and cannot do. So take that in mind next time something comes up, okay? I appreciate the letter, but just wanted to point that out, that we've tried, we've conversed together, and so there's limitations on what we can do in our conversations with health department, and they're working with the county commission. I just want to let you know that it's up to us individually and not government to get this thing working. Okay? Thank you.
Thank you. Any rebuttal or any comments to?
I'll just,
Very quickly.
we worked on that letter together, and that probably wasn't worded very well, but what we are calling on you to do as leaders is to endorse the actions recommended by the people who work for you, to, at least to Aubrey's words, establish the guardrails to keep us safe. That is within your realm of influence. Is that true? Am I completely misunderstanding?
Part of our responsibility, you stated in there really well.
Mm-hmm.
Health, safety, and welfare of the citizens of Reno County.
Yes.
You're making the assumption that the guardrails you want are going to do that.
I'm not making that assumption, sir, with all due respect. I'm not making that assumption. Experts much smarter than me have implied what will work.
That's not true.
Oh, no, it is true.
Anyway, we're making the assumption that those guardrails are effective, and we've not seen any evidence of that. And the overwhelming...
What evidence are you waiting to see?
The overwhelming scientific literature shows that masks don't work.
I didn't bring this thing up, but what I wanted to do was just let you know that government is limited on what we can do, and it's up to the individual to do that. That's what I was trying to bring up.
Well, then here's to the individuals and what we can do. Let's go, Reno County.
Thank you. Thanks, Aubrey.
May I say something else?
You bet.
Commissioner Hurst, I hear you, and I do believe that each of us has to make the strong decisions for ourselves. I don't mean to imply that this isn't my responsibility as a person or anyone else's, but I think that we should have a multifaceted approach to this, and that when I'm making my own decisions and you are laying out the guardrail for us, it's going to be an even stronger return. But I don't mean to take away the individual responsibility of it either. I know every day in my own house, we're having these conversations about what we will do and what we won't do, and how we're going to protect each other and the people around us. So it is my responsibility, but I think that just laying it out there for us gives us just another level of the battle against COVID-19.
Thank you.
Okay, thank you. Okay, we have Donna Patton back there in the corner, who's kind of our doorkeeper this morning, our county clerk. We appreciate you filling in for someone that can't be here. Donna, would you please ask the next person that's signed up to come in and speak to the county commission? And you might have Donna, the next person, come to the door so that we don't have quite as... Yes, sir, if you come to the podium, I assume we're discussing county health at this point in time. Please introduce yourself. You have 5 minutes to make your comments, please.
My name is Lyndon Rock. I'm a concerned citizen, and this is concerning the shutdown that we had back in March. And I would beg that we don't do that again. Not that it affected me directly, but back then I had many discussions with different people in the community. The one thing that I had, and I'm not a prophet, but one thing I had kind of speculated was, one, we're going to have a spike in cases because of wearing masks. I don't know why health people, and I'm not an expert, they're the so-called experts, but the way I understand the body is we breathe in fresh air, the oxygen takes it through the blood, and then the blood does what it does, and then it kicks out carbon dioxide. And I turn around and regurgitate this, and I'm scratching my head and I'm going, we don't do that to our own vehicles. We don't do that. I don't do that to my animals. I don't muzzle the sick ones. The best thing that I think we could do is give them fresh air. And that's the thing I don't understand about masks. I have friends that haven't gone to church since March or February or March. And back then, church was not an essential. My perspective is church is more essential than ever when we are going through this kind of a deal. Because I realize in church, or because of church, I realize that the world is bigger than me. And I think we have lost that perspective. I need community of believers, the fellowship with community of believers. I need the scripture, constant reminder of the scripture of who I am before God. God actually created me like he did all of us. And he didn't put a mask on me to, I don't know, breathe in carbon dioxide, and I'd go back to that again. To me, my business does not have paid leave, does not have sick leave. So I look at it as I need 4 things to keep me healthy because I have to work every day. I milk cows for a living, and I have to feed them every day. I don't have the choice of calling in sick. And there's 4 things I wrote down that I think that I need to be healthy, and that is fresh air, plenty of sleep, plenty of fluids, and being productive. And when the county shuts down, these so-called businesses that aren't essential, whoever defines what that is, I can't imagine sitting in the house all day and not being productive. That is part of my mental health. And I think it can spiral out of control when I'm quarantined or told to stay home for 4 days, or 2 weeks actually. I don't know what I would go nuts. My kids have called me an odd man out, that I'm not normal, which I'll probably agree with them. Now, my father-in-law passed away back in September. And the irony of it is, when he was taken to the hospital, and I'm not being critical of the hospital, they do what they do, and I have no issue with that. But he went in because he had a blood infection. He was moved from the nursing home to the hospital because of blood infection. And they immediately tested him for COVID. It came back negative. They weren't satisfied with the answer, so they tested him again to make sure. And I don't understand why that is. We came back the second time, he was negative. Well, he was in the hospital for a couple days, and then they moved him to a hospice house where we could actually go in and see him. Our family went in and saw him. He actually, it seemed like he kind of improved. That's just my perspective. But he did then succumb to his infection. But it had nothing to do with COVID. And about 3 weeks later, his brother Fred passed away of COVID. My wife had told me that that Fred had COVID and that he was not doing well. And I was, oh, okay. And that evening, they called and said that he had passed away. And it was chalked up as a COVID death. And I scratched my head and I asked my wife, I said, so how long has he been on oxygen? She doesn't remember. She doesn't have a clue how many years he's been on oxygen. Wait a minute, I thought he died of COVID. Well, yeah, he did die of COVID, but he was also on an oxygen bottle for so many years, we don't even remember how long.
Mr. Rocker,
And he also had diabetes.
5 minutes is up. Is there any questions of the commission of the speaker?
Yeah, I want to hear your 4 things you need again to survive. That was really, really good.
To me, it's fresh air, plenty of sleep, plenty of fluids, and to be productive. I have to be productive. That's just me. And the reason is it helps my immune system so that if I do come down with COVID, my immune system can fight it off rather than, and it's not that I don't want to get sick and I don't wish it on anybody, but.
Thank you. I might mention that your church you can attend your church if your church sees fit to be open. The only restriction there is social distancing.
Well,
thank you very much.
And the new order will be the same if we pass it, so. New Malin and Fred.
Okay. Yes, sir. Would you please come forward and introduce yourself, state your name and address? You have 5 minutes to talk about public health.
Good morning, gentlemen. I'm Chuck Miller. I live in 301 Hyde Park. I'm the executive director of the Fox Theater. You've all heard from me, and I appreciate your service to the community. As a way of background, I'm a former broadcaster. I've worked with Georgia Emergency Management, Louisiana Emergency Management, Kentucky Emergency Management. Led the rebuilding, our part of the rebuilding of New Orleans after Katrina, and served on the Kentucky Association Broadcasters Board for 4 years. And I came to the Fox for a great opportunity. And I think it is a great opportunity. And we were just getting going, and then this, of course, struck us, and it struck us pretty hard. I thought we were getting there. I thought the politicians were getting there, our leaders were getting there, and then this became a political issue sometime in May, and the writing was on the wall for us. You're doing what you can do, and I appreciate what you're doing, what you can do. Our situation, and I'm also the president of the Kansas Historic Theater Association. Our economic impact so far, without everybody reporting, is over $14 million. The Fox's impact is about $1.4 million. We're doing nothing. We're not paying you taxes. We're not paying the state taxes. We're not providing entertainment to the area. No social release. We can't do it, and we understand we can't do it because we can't put this thing down. We were ready to mask up and do some shows. It's exploded. I'm so tired of junk science being reported. I know you have a real issue with all these scientists and all the social media coming at you, and I really encourage you to let's all just do it together, do it in peace and harmony as good Christians, and get along and put this thing down and let us move forward. Hope is on the horizon, but we're not going to open until June, and that's very hurtful. It's very hurtful for us. I don't see it coming anywhere else. I've lost 4 friends. I wasn't going to come here until my good friend in Illinois died from COVID. He's my age. It killed him. We've lost 3 dear friends, 2 here in Hutch and 1 in Ohio. And we have to stop this. And I know you're doing your best to stop this. And I implore you to look at both sides of the science and make your best decision, because there is 2 sides to every story. I thank you for your time.
Thank you, Mr. Miller. Might note that he took much less than his 5 minutes. Appreciate that. Mr. Wells, please introduce yourself, your
Yes.
address, and you have 5 minutes to talk about Reno County Public Health.
Yeah, thank you. Brock Wells, 212 West Avenue B, Hutchinson, Kansas. I am a doctor of chiropractic, and I'd first just want to put out some data to show that that we can be hopeful about this. First of all, the survival rate hit a new high in Kansas on November 11th of 98.9%. So that's all ages. 0 through 17 has a 100% survival rate in Kansas. 18 to 64 years of age has a 99.8% survival rate. 65 to 84 has a 95% survival rate. And above 85 is a 84.6% survival rate. 46% of the deaths as of November 11th were in the nursing homes or long-term care facilities in Kansas. And so outside of the long-term care facilities, the overall survival rate for all ages is 99.4%. Reno County has an average death age of 78. The median is 79. And the current survival rate in Reno County, if I did my math correctly, is 98.7%. And the CDC says the survival rate under the 50 years of age is 99.99%. So, as you can see, this virus definitely has a weakness in that we can exploit. But, we are very blessed that the hospital is doing everything they can, and they've got, like Rex said, or Dr. Rex said, I think they've got 4 pulmonologists. Was fantastic here. The point is, with that, I just want to point out before I go on about the mask, is that because of the governor's lockdowns back in March and April, it's public knowledge to know that the hospital had to furlough nurses. And so some of that staffing issues can be directed back to the lockdowns and more restrictions. So as far as masking, I got some handouts for you guys, but I'll just go right into that. Since the governor put in her mask mandate order on July the 6th, I believe.
July 2.
July 2, thank you. Reno County has had a 2,750% increase in cases. Counties with mask mandates have had a 914% increase in cases. Counties without mandates have had a 423% increase in cases. And this was the data that Lee Norman tried to present back in August and was found to be misleading the public. Going to leave that right there. And as far as, and I've looked this up through the rest of the world, right? Austria, Germany, they all put in these mask mandates. Spain has the highest compliance in all of Europe, and they've had a 1,500% increase when they put in their mask mandates. Belgium, same. They have one of the highest rates in the world, and they're shooting up after they put in the mask mandates. So the point is, with all this, is we see the cases rising, and we see the deaths, and we get very emotional and fearful, okay? And we want to do something, right? Well, this is a virus that is released into the public, and there's nothing that the government is going to do There's nothing that these, the masks that are going to do, or the restrictions are going to do to help stop the spread of the virus. You know, if you go barricade yourself in the house, yeah, you're probably going to not get it and slow the spread. But we've got to live, and we've got to have these businesses producing. And so, you know, the last point I would like to offer is I would, with the commission's permission, get together with the Reno County Health Department and talk about, maybe put out a flyer or something, since Balcom is doing some marketing, put out a flyer or something about natural treatments that we can do to help boost that immune system.
Okay.
And things that we can do, especially through the winter months.
Thank you very much,
Do you have any
Rob.
questions?
Yeah, I think there's some great points there, particularly the one I like to make, and I've made over and over, and I got corrected last week, corrected incorrectly. The Kansas survival rate from age 0 to 17 as of 12:30 on Monday remained 100%.
Yep.
No question about it. And so, yeah, we do have the opportunity to study this virus, revise our approach to it, and move towards focused protection. We need those schools open. We need to quit preying on our kids. You know, they tolerate this without a hitch, and we're sacrificing their education in the process.
Right. Yeah. And I mean, you know, the quarantine and our response to COVID is, you know, we definitely need to reevaluate, because that is what is causing COVID. You can make a case that COVID, the virus itself, is not causing the absentee from businesses. It's not causing the kids to not be at school. You know, it's our response to COVID and trying to control things that we cannot control right now.
Thank you very much.
Very good. Thank you.
I'd just like to comment a little bit that I had the same data that you presented here. It was from the KDHE.
Yes.
And so.
I was not clear on that yet. Thank you.
Okay, I see Mr. Welch came back in. Do you have comments, sir?
Yeah, just a quick response. Again, Chuck Welch, Vice President with the hospital. I just wanted to respond to Brock's comments about the furloughing and what was the cause of that. The reason that we had to furlough staff, much to our chagrin, had absolutely nothing to do with the governor's mandates or actions to, limit exposures. We had to lay out or furlough nurses who have since all come back, the ones that wanted to. They're completely fully employed again. We did that because we had suspended elective procedures and a lot of the revenue sort of generating things that go on in the hospital. So business was down, and we were forced to do what any business does, and that was to give the option to furlough for a very short time. So
which proves his point that the damage was caused by the reaction to the virus, not by the virus. So very nice job of making his point. Thank you.
I'm not connecting the dots. I'm just telling you that it wasn't to do with the governor's.
It was the lockdown. It was the shutdown of the hospitals. When the hospitals quit seeing patients, they didn't have any use for their employees, and they furloughed them.
We did it to reduce exposure, and elective procedures that come in, that increases possibility for exposure. I'm not going to leap to conclusions. I'm just here to let you know what the facts
saw
are.
it at multiple hospitals that I practice at. The nurses were furloughed because the hospitals quit taking patients in, and you can say that's because they didn't want to expose anybody to the virus, but it's still the reality. It was the reaction to the virus or the threat of the virus. It was that caused the furloughs and the loss of employment and the loss of income.
Again, that's a leap, but I'm just here to tell you that it was not a direct action according to what the governor did. So thank you.
Thank you. Okay, who's next, Donna? Yes, ma'am. If you'll come to the podium, state your name and address, please, and you have 5 minutes to speak on Reno County Public Health.
Thank you. My name is Tanya Ferguson, 1900 East 56. I'm a passionate, naturally minded mom of 4, and I'm also privileged to represent the top 2% of the world's largest essential oil company, doTERRA, which means gift of the earth. My job is to empower people to use safe, natural, 100% pure essential oils to manage their family's needs proactively, a big missing piece of this puzzle. I was invited to briefly talk to you today about some simple steps for creating wellness in both your home and body. You would be surprised how many people skip these simple foundational actions like eating right, drinking plenty of water every day, taking a high-quality whole food vitamin, limiting sugar intake because sugar paralyzes the immune response for hours, reducing the toxic load on the body by greening up household, cleaning, and beauty products, increasing sleep and sleep quality with natural tools. When we rest, we restore, we regenerate, and we heal the body. Washing hands as soon as we get home with a safe, natural, non-toxic soap, kicking your shoes off at the door to limit outside germ exposure, and moving your body daily to get fresh air and sunshine to oxygenate and support all body systems. We want to maintain healthy emotions because poor emotional health and high stress do lead to a depleted immune system quickly. When we check the list on these foundational items, we begin approaching health proactively instead of reactively, and big things change. In my line of work, our goal is to educate people on how to create wellness with these daily healthy habits, to empower them to combat illness with safe, natural, easy-to-apply tools at their disposal, at their home, no matter the hour. We offer classes and have a thriving online community where we teach people how to use these tools. I strongly believe the same creator that created the universe gave me every tool in his creation to heal, restore, and repair my body. I love having safe, natural tools at my fingertips that work.
Ma'am, if this is an advertisement, I think you need to do something else.
It's not an advertisement. This is not an advertisement. I asked her to come to talk about other options to help people be prepared to take care of themselves. So, no, this is not an
I think
advertisement.
as long as she doesn't speak about one product, I think she can continue.
Okay.
She's doing perfectly fine. Thank you.
Let the chair address who is perfectly fine and who isn't.
I'm happy to participate, and I'm going to participate.
I noticed
Not going to
that.
bow to your wishes.
I noticed that.
Under any circumstance.
Okay, ma'am, you've got 3 more minutes.
I was using some tools for nature before I came today. I like to use a more immune support, which is like putting my body in a bubble. It's a powerful tool to combat viral and bacterial threats. We have tools for home sanitizing that are safe and natural without the use of chemicals so that babies and bare feet and pets can live safely in a greener, healthier environment. We have natural hand soaps that we can utilize. There's so many tools being overlooked. And so my job and my goal is to empower people to look at those other options, to create proactive wellness instead of reactive. We offer protocols for the current threat we face. We have a protocol for someone that's staying home during a home quarantine with a sick loved one. We have a responsive protocol for someone that wants to utilize symptom management tools and olfactory retraining naturally during the duration of the virus. We recognize at doTERRA that health is a gift, not to be taken for granted. Health is a choice, not mandated or forced upon us. True health is linking arms with people and showing them the options they have to change their life and health in amazing natural ways. It's a community of caring voices, helping them to use nature as medicine, because as Nushin Razini said, nature has the power to heal because it's where we're from. It is where we belong, and it belongs to us as an essential part of our health and our survival. And I think it's a really big key that is being overlooked in surviving and thriving during the current threat in our community. Thank you.
Thank you. You know, I asked Tanya to be here because, like I started this conversation last week, traditional medicine, modern medicine has totally failed us on getting people prepared to deal with this virus on an individual level. They've gone as far at the state level. The Kelly administration has taken away hydroxychloroquine. They've taken away nebulized steroids. They've really left the person who isn't sick yet or starting to get sick with nothing. Now, you know, for myself, you know, it's a multivitamin every day. It's access to vitamin D, zinc, Prilosec. Where I'm on no blood thinners, I'd take an aspirin twice a day. You know, there are regimens out there that they're not proven science, but they're hope, and they can be done safely, and it beats the heck out of a taxpayer-funded fear campaign.
Okay, thank you, Tanya.
Thank you so much.
Donna, about how many more people do we have?
I've got one more on the list.
One more? Okay, we'll do that before the break.
Okay.
I take some of those same things, Mark.
Good.
Thank you.
Not all, but some.
I always just say what I'm doing, because I'm not trying to practice medicine here.
Good morning, ma'am. If you'll come to the podium, state your name and address, and you have 5 minutes to speak on Reno County Public Health items only.
Okay. Hi, my name is Dawn Varney, 34 East 27th Avenue, Hutchinson, Kansas.
I'm sorry, state your name again.
Dawn Varney. I've spoken here a couple times before. I am a licensed physician in the state of Kansas. I am a medical researcher. I am published. There are sciences and there are sciences. There's real research, there's prospective research, there's cohorts, there is retrospective. Back in this summer, 750 petitions were given to you guys asking for you to base any recommendations on research. Nothing was done about that petition. I understand there's been a petition presented today. It doesn't hold any more or any less importance than the petition of 750 people that were presented to you that were gathered back in 5 days last summer. Just so you know who I am a little more. I am at very high risk of any COVID complications. I've had a myocardial infarct. I have severe asthma, which was induced by the dye from that infarct and the dye that was given to me for the calf. According to the CDC, people with breathing problems should not be wearing masks. Also, according to the CDC, that includes approximately 20% of the population. You go to Walmart, like I did 3 days ago, I was told, put a mask on. There was me and 2 other people that did not have masks. There's a lot of people walking around with masks on because they are living in fear and not because of any science. I do want to thank you for informing Dr. Polly that he will have 5 minutes from now on and won't be able to pop up all the time. As far as regarding hospital staffing, I was the director of nuclear medicine at our local hospital beginning January of 1994. There were staffing problems back then. I was begging. We wound up with rent-a-techs because I was asking for top quality people. Eventually, my department was staffed, but it was also staffed with somebody came over from EMS to help us. So staffing problems don't have anything to do with COVID. They don't have anything to do with masks. The death rate is going down, even though the COVID rate is going up. Sure, the numbers are going up. It's a pandemic. That's what happens. More people get exposed, more people get it. As I said, I am at high risk. I have a heart attack, I have asthma, I have a hyperimmune system. I have lots of risk of having issues, but I don't wear a mask. I also want to make clear that I did not vote for Dr. Stephan. I wasn't one of those people. We had information that was given to you before, and it shows from the influenza epidemic that the people who wore masks had no better outcome than the people who did not. I've given this to you before. I don't think it's probably looked at, but it may have been. I don't know. In masks, in Kansas,
about 30 seconds, please.
There is only one new research that has been actually done on COVID, and it has been disallowed to be published anywhere. Not being masked does not mean that COVID is going to spread. A little over a month ago, there was a event in an adjacent county that had over 1,000 people there. We were very close. Not one person showed up with COVID. Associating masks with the increased numbers, it just doesn't work.
Okay, thank you. Your time is up.
Thank you.
Thank you very much for being here.
Dr. Varney, are you familiar with Dr. Meehan's article and evidence, called An Evidence-Based Scientific Analysis of Why Masks Are Ineffective, Unnecessary, and Harmful? Have you seen that review?
I have not.
It's a review of the science that regarding masks, and it kind of gets into that pyramid of quality of studies that you were talking about a little bit, with meta-analysis at the top, systemic reviews, and at the bottom is just background information, just anecdotal stories, and kind of like you were talking about. And it really does, is it walks you through all the studies. Like you say, there hasn't been anything new regarding the China virus in a society and its ability to decrease infection rates. So there is no gold standard. While the best scientific study indicates that masks don't only do not work, but really do have the opportunity to cause harm. And I, as a physician of over 30 years, and through that time you become an expert of observation of human behavior. You see the breakdown of the sterile technique with masks. Moving the mask, you have your hands in your face exponentially more than you do without a mask. And so, yeah, the science certainly doesn't back it, does it?
No, a meta-analysis is where you take all the research that was previously done, you combine all that data, and you come up with what all the different studies did. Some may be negative, some may be positive, but it puts everything together. Meta-analysis would be the top level. When it comes to wearing masks and the sterile issues and all, masks work for bacteria. They work a whole lot better. Viruses are just incredibly tiny. We've got somebody here who...
Thank you, Don, very much. We really do need to continue. We've given everybody the same amount of time, and you're even gone over 2 minutes, and I appreciate your thoughts. Thank you. We have one more person, and then we're going to cut off public input on this for this morning.
Okay.
Sir, come to the podium, please. State your name and address, and you have up to 5 minutes to address the commission on Reno County Public Health.
Yes, sir. My name is John Morgan. I'm a Reno County resident. Do you need my actual physical address, or will that be sufficient?
Yeah.
14414 East 30th. That's considered Buhler, Kansas. 67522.
Yes, sir.
Yes, this really won't take more than probably a minute. As I'm listening to this, I came down today, I just want to kind of get a sense of where everybody's standing with this, because I wasn't familiar. I will say, here on the CDC website, when it's talking about wearing masks, and they recommend wearing masks, they says, do choose masks that completely cover your nose and mouth. Talks about, bear with me here one moment, how to wear a mask correctly. Do not touch the mask when wearing it as well. The reason I mention this goes back to the consistency and potentially the hypocrisy of it. And I apologize, I don't remember the lady's last name. I believe it was Aubrey. I think she's from, correct me if I'm wrong, and I apologize. This isn't meant to necessarily call her out. However, I see that she seems to be an advocate for this mask. I've noticed her mask does not particularly cover all her nares completely. I noticed additionally, as I'm sitting out here watching, she's touched her mask 2 or 3 times as well. So as an advocate for everyone wearing masks, I know they've asked the commission to be an example for the community, but I think if you're going to come up in a meeting of this nature and ask for that, I would expect that you would do the very same thing you're asking others to do. So that's really all I have to say. I kind of despise hypocrisy. So if we're going to do it, let's do it. If we're not going to do it, let's not do it. I know people say, well, we're going to I'll touch my mask, but I'm not terribly worried about it. So Another thing that's not, besides we're talking about masks, but they also recommend washing your hands. They also recommend social distancing. There are many people out here who are advocates for wearing masks. They're not social distancing. I've not yet to see anyone go out and wash their hands. Are we going to insist at Walmart that before you come in, we need to watch you wash your hands as well? That's my question. It seems to me that we're not really doing the whole thing here. And so you can see where people are frustrated in the community when even the advocates for it are not practicing what they preach. Personally, if you want to wear a mask, that's fine. If you do, you don't. There's a lot of mask shaming going on. If you don't wear a mask, you're dirty look. That's fine. I don't know anybody going up to someone wearing a mask and berating them in any way at all. If you want to do it, do it. So, the kids will practice football where they're right against each other's faces and sweating and spitting. I think if you guys are going to have to get in line and tell us what's going on, or you're going to have to. I can't do that with my kids. They notice what I do, not necessarily what I say. So that's all I would ask. I probably seem a little passionate about it, but I just despise hypocrisy, and I just despise that sort of thing. So I appreciate your time.
Thank you,
Thank
sir,
you very much.
for coming this morning. Okay, we've had lots of presentations, lots of discussion on public health this morning. Is there any more comment from the commission on public health?
Well, I'm going to carry on just a little bit, Commissioner Sellers, if I may. I think that, as I said before, government cannot solve the increase in COVID positives. It's up to each one of us. In fact, the government can't solve most of our problems. It's up to each of us to do that. Use your head, respect each other, do your civic duty and responsibility to your fellow man. In some of my emails, excuse me, I've asked for ideas and suggestions. I've received one person had some ideas and suggestions back, and I've passed it on to our county administrator as well as Laura, our communications director, is to bring about positive things and not just relish on all the negatives. She gave us some examples of that. I say support, and I think this commission would agree, to support your local businesses and respect them as well as respect each individual person. I may not agree to the mask mandate, but I assure you it won't hurt me or kill me if I have to put a mask on for a few seconds or minutes or part of an hour to go in and shop at that door and get what I need. The virus is harder. This virus happens to be, from what I gather, harder on our health system than many others. It does what viruses do. It spreads. And our own immune system will either handle it or not. And that's when we're going to need some medical assistance to overcome the virus. We individually, in my opinion, need to do what we can do as to have room in the hospitals to care for those who immediately need life-saving procedures, along with doctors and staff to carry out those procedures. And I think that's all I want to talk about. Thank you, Commissioner Sellers, for giving me an opportunity.
Are there any other comments by the commissioners this morning on public health? Okay, if not, we've been in a session for an hour and 25 minutes. We'll take a 5-minute recess and reconvene at 10:30.
Okay.
meeting of the Reno County Commission. At this point in time, we'll determine whether there's additions or revisions to the agenda. Commissioner Stefan, I heard that you'd like to add an item. Is that true? On election?
I inquired about a brief review of the canvassing, if that's what
Okay,
you're talking about.
I think they're going to be here. Okay, we'll put that down as item B under business items.
And it's just a short review by by Commissioner Hurst would work.
Well, I think we've got our county clerk possibly here and our election
She's here
commissioner.
anyway.
She's here anyway, so we might as well have her speak. So we'll put that down as business item B. Okay, is there approval of the agenda as altered? Anyone? Motion, please.
Just got a question. This health order is approved if we don't do any action, correct?
That's my understanding
Yes.
from our county counselor.
That's correct.
So what are our options?
Pardon?
What are our options in regards to that?
The options. Randy, do you want to cover that so
Yeah.
I don't make a mistake?
Yes, the health order can be issued by the health officer. The county commission has the ability to overturn it. You can vote, and a majority would overturn that health order. So that would be your option.
I would certainly like to vote on it.
Okay, we'll make that item
C.
Business item C. And let's note that as a discussion and possible motion of the Reno County Health Order 20-04. Now, is there a motion to approve the agenda as amended?
I move to approve the agenda as added.
Is there a second?
Second.
The motion is second. If there's no discussion, please call the roll.
Commissioner Hurst?
Just a second, please.
Commissioner,
There's discussion.
Chairman, were you going to add the Sparks disbursement to the consent agenda?
No, I'll speak to the consent agenda after we
Okay.
get to the,
Okay.
that point. Thank you, though.
Okay. Yes.
Commissioner Stefan?
Yes.
Commissioner Sellers?
Yes. Okay, moving on to the consent agenda. We have vouchers in the amount of $965,725.76. We have COVID expenditures this week of $407,961.39. And item B on the consent agenda is a letter of support for disability supports of the Great Plains for a KDOT grant application in the amount of $7,143 for operating assistance. I believe this doesn't involve any county monies. Is there a motion to approve the consent agenda?
I would move to approve the consent agenda as presented.
Is there a second? I will second. Go ahead.
No, you go ahead.
I will second it. Is there any discussion of any of these items? Seeing none, please call the roll.
Commissioner Hurst?
Yes.
Commissioner Stefan?
Yes.
Commissioner Sellers?
Yes. Moving on to business items. Item A is a request from Idea Tech to enter into a wireless attachment lease with the county, attach certain wireless equipment on top of Highlands Water Tower. I believe we have someone here from Idea Tech to discuss this with us.
They're on their way.
Okay. Good morning. Please come to the podium. Introduce yourself. We're ready to hear your presentation on your request to put some equipment on a water tower that the county owns.
Well, thank you very much. My name is Ethan Kaplan. I'm General Counsel at Idea Tech. With me is also Nate Oswald, who's Director of Sales. Throughout these past few months, and really, it's been our mission all along at Idea Tech to provide rural and underserved residents with broadband internet. It obviously has become increasingly more important based on all the remote schooling and the need to access that. So we have been working with communities, cities, counties, local landowners, trying to establish ways to provide this internet. And one of these ways is to provide these wireless solutions. It'll provide them with the fast internet, low-cost solutions. And so before I get into the technicals, because I'm more of the legal mind here, we've been in talk with Joe O'Sullivan and Randy Partington about some of the possibilities of reaching some residents over in the Highlands area. It actually will reach, I think we found out, it's about 81 residents, putting something up on a tower out there. So what we're asking is basically you have an asset out there, it's the water tower, and we'd like to put our equipment up there. We're fine with whatever sort of supervision or access requirements you have. We just think in the fact that we need to expedite this, that is the fastest and the easiest solution. Again, we are in schools all over the counties in the state of Kansas. We know how to work professionally. We know how to install equipment professionally. We know what's required. And we think this is going to be not only a good revenue source for the county, but it'll also allow for us to reach these residents who right now need the internet. Okay, so with that, I'm going to hand it over to Nate Oswald. He'll answer any technical questions.
Morning, gentlemen. Nate Oswald, Idea Tech. I'm here to answer any questions. We're looking at up to 8 antennas. The antennas are lightweight antennas. They're maybe about 10 pounds, so not much weight there. Really here to answer any questions if you guys have questions.
Okay, Nate or Ethan, either one, when this was mentioned to the commissioners, I think some things came into question. I'll bring those up, and then I hope the other commissioners will elaborate if I'm not fully explaining the items. One is for a concern about, is this tower such that it will hold this equipment in a safe way? And there was the suggestion there that the county would need some type of professional document stating that this is not an impediment to the structure. I'm assuming that in this contract you're prepared to provide that document?
Yes, once approved, what I'll do is I will work with Mr. O'Sullivan and Randy Partington and get everything approved. I just think we need the authorization from the commission, obviously, to allow it. And then all the terms and everything will be, as far as all of this is concerned also, we'd just like to say, we provided some information on the agenda that will outline it, and we're happy to provide whatever professional documents you need. Again, we've been doing this all over Kansas. Actually, recently, I think we've added some references in there, especially like Finney County is a recent one that would be a great, I guess, similar site. So things like that, we'd be happy to work with you on. We're happy to work with Mr. O'Sullivan to provide whatever you need to feel comfortable.
Well, I guess I think maybe we could have moved this further along if you would have provided some of these details today, at least in my mind. The county is concerned about water security. Would this document cover how that is going to be taken care of?
Yes, so it'll essentially allow either or require that there either be supervision if you do, or any sort of restricted access to the property. We didn't want to talk too much about the safety. I think we put in there about, there's obviously concerns with someone going up and security access. Again, we're in schools. We're all over the county. We're professional. We do background checks. We make sure that this, and obviously, if something like that was to happen, there'd be an indemnity clause. It's not going to happen under our watch. And again, any sort of supervision or restrictions, we don't need to be up there a lot. That's the thing, is literally, I think we need about a week of installation time, which again can be supervised, and then maybe 1 or 2 times a year just for maintenance or for any sort of upkeep.
How long do you feel like it will take an engineer to give you the document that would say that this is a safe installation for to be done?
Nate, do you know that?
I do not.
Okay, well, I mean, time is of the essence here,
I
obviously, for us, so
understand
we
that,
will
and
do what we,
we're not necessarily wanting to delay this, but I
Sure.
think that it's prudent as commissioners to make sure that
absolutely.
these things are in place before we say go.
Well, and again, I think you have, obviously, the community's interests at heart, and I think that would be something that can be discussed and provided to someone who would have the ultimate signing power.
Well, but Joe, O'Sullivan, doesn't the commission have to sign this lease?
As the governing body of the water district, yes.
Yeah, so I think even though you can negotiate and
Right.
back and forth with the county councilor, the county commission will ultimately be the decision of whether this is approved or not.
Right, and I guess what I can say is, it's, as Nate said, it's very lightweight equipment compared to the thing. We can provide that document.
But we do know that this is just a walk rail, I believe.
Correct, this is not actually into the tower.
It's not part of the structure of the...
Right.
Okay.
Commissioner Sellers, that was one of the considerations I had, but when you say there's 10 pounds and there's 8 of them, that's only 80 pounds. There's more water collect on that in the rain on top of that tower, I would imagine, at least that much paint, but that doesn't concern me as much as it did earlier when I find this out.
I think something to note, these towers are built to have infrastructure on the top. I mean, they have channels running through them for cabling to get to the top, and then there are 3 basic methods of processes to mount on the top. It's not going to be anything that would go into the metal. We're not drilling, we're not welding. There is mounting procedures that are put in place to ensure that there's no physical, damage to your facility.
Okay, the third item on my list of concerns in this document is, Mr. Kaplan, I think you kind of alluded to it, that there's, well, and before I ask that question, I think we need to think about the condition of this railing, because if we approve it for you, we might get a request from some other person to do something, so.
If I may speak to that, too, that's a great question. And like I said, this is basically an asset you have that you'll be getting revenue from us.
And
If other people want to come in and do that, no one's done that as far as I know. No one's done that or had the I guess, inquiry to go up there. If we're up there, if they go up to compete with us, I mean, obviously that's more revenue for you, but it's
Sure.
also one of those things where they'd also have to do a study or determine whether this is feasible or not.
Sure.
This is more of an emergency ask at this point, because it's the fastest way to get these people internet.
Well, I don't
Yeah.
think there's, at least on my thought, any reason to try to slow this down. My final question is that you talk about there's a revenue source here for the county because of your equipment, to the water district, because of your equipment being up there. What is that fair value? I do not know. What is your proposal? What are we going to get?
Typically, what we would do is determine a monthly amount, a monthly lease. It could be anywhere from $200 to $250 a month, something of that nature, and then.
And so.
And we would base that on a fair market value. I mean, we have a number of these towers that we've placed on, and so we could go through that and do a proposal based on what we consider the fair market value with what we've done with other water towers and elevators and towers.
What are you paying City of Derby?
City of Derby, do you know?
I don't.
I do know that in the realm of what we're typically paying is around the 200 and 250 mark. I don't know specifically to Derby, but I would assume that it's right in line with that. It's all based also on a business case. So Idea Tech's going to look at it, and we're going to say, this is the radius, this is what we can cover, and this is the amount of people that we can potentially get to. And so we're going to pay more a month for somebody that we can get to 1,000 customers than from a tower that we can get to 80 customers. But when it's said and done, it's going to be about a value of about $200 a month.
What's the opportunity to increase that distance so you can get more than 81?
Well,
I presume it's tower, so trees and et cetera, hills and so forth make a difference on reception.
That's a great question. I can't speak to what it's going to be in 2-5 years, what the technology will bring.
I mean, today.
Today, that's a radius that we're very comfortable with, and that's where we're going to leave it. We're not going to go outside of that. That's the radius of what we can confidently provide a good speed and a price point that would be fair to the customer. So that radius is not going to change.
Competitive speed?
Absolutely. So what we're looking at right now is a 100 meg product will be available, 100 megabits. And that is a speed that typically we do not see in these regions. I would say if we went out and checked, the competitors in those areas, maybe they would have a plan, but if you're going to run a speed test, you're probably going to get more into the 2 to 5 meg is very typical. And we're coming in and we're going to do a 100 meg option.
And one thing I remember about last time was the question about the revenue effect to the county on the status, tax-free status of the water district. Has that been checked out yet, or would be before we get this, I presume?
Yeah, that was something you were looking at, the tax status.
Commissioner, what you're talking about is that the property itself is tax exempt. We're not talking about income tax or anything. We're talking about the property, the water tower and the land on which it sits is tax exempt.
Okay.
And that's because it's used for tax exempt purposes. This is not a tax exempt purpose. So the question is, if you factor in a commercial non-tax exempt purpose, to what extent does it affect the taxability of the property? I've talked to the county appraiser's office about this, and it's my understanding that it will not affect the taxability of our water tower itself. That is independently tax exempt by statute. However, it might affect likely to affect the land upon which it sits. And particularly, and we haven't talked about this, I don't know whether all of the structures are on the walk around the outside perimeter of the water tower, or whether there are structures on the ground as well. I mean, I don't know anything about those components, but there is a tax concept, and if you did lease the property, certainly to the extent that if there's a tax burden, that would be passed along to Ideatech.
Okay.
Whatever it might be. And
all right.
Yeah.
Thank you.
So theoretically, you could lease it for a certain amount of months plus whatever tax consequences there are.
Are there other concerns of the commissioners about asking the county councilor to work with Ideatech to produce a lease?
I'm fine with a satisfactory lease agreement.
I think there needs to be some more serious negotiations in regards to the compensation for it. I'm not impressed with that amount.
I'm not an expert on compensation for towers, but I think we can ask the county councilor to look into what an appropriate amount might be to request.
I wonder if you guys would address the time frame in which this has to be done, and why we're kind of doing this on a I'm not going to use the word emergency, but
you want to take that?
Yeah. Why that's the case.
First, I want to address your concern, your question as far as compensation. When we've established that there are 81 homes out there, 81 premises that need internet, and we can provide them with the internet, of course we want to compensate the county for use of that asset. And so that's where we come up with the figure, but it's all based on a business case. It's we're not a cell phone company, we're a broadband internet company. And so our ability to reach just this amount of people, that's where the market share comes and the fair market value comes in. So it's not like, it's more of a matter of, right now people are in need of this internet, and that's what you're getting to, I think, is right now what we're talking about is by the end of the year, the state.
Is that because of CARES Act
Yeah.
money? Yeah.
We have the CARES Act. And the state is putting forward this initiative of trying to expand broadband to underserved people, especially with the remote schooling, the remote working. People need access to internet because that will alleviate a lot of the concerns. Sure. And Ideatech has been, Ideatech is Reno County, home-based. We set up hotspots at the beginning of this for schools to come, to have their kids come to help with the schooling. We did that at no cost. You know, it's things that we've been doing for the community to try to get this done. So when we're talking about 250, we're not trying to pull one over on the county. We're just basing it on a business case and on what we could basically manage to do based on circumstances. And that's why we're even coming to the county. Because we could go out there and look and try to build a big tower and do all this, but it doesn't make sense because it just would not reach.
Is there an existing tower that y'all looked into using?
An existing tower?
An existing competitor's tower?
There is a competitor's tower that reaches the Highlands. That's Crazy Communications. But he doesn't reach out to the 81 households. And I don't know what his plans are, but I don't know what his mission is either. At this point, we're just asking.
Did you all look at using that tower?
We looked at buying the tower, and he won't get back to us. So now we're looking at what are the other options.
What does that tower do?
It's a tower, I believe. Yeah, go for it.
Okay, so I've talked, I've tried to meet with that gentleman a couple times that owns that tower, and frankly, we've had a lot of requests from the area. You know, we're not coming in trying to overbuild. If he had something there, we wouldn't be here today. The reason why we're here today is the people in that area are reaching out to Idea Tech saying, we need something. We need something better. We need a bandwidth that's sufficient, that is reliable. That's the main thing that we're struggling with out there. And so we're trying to go in to where these people are coming to us. And that tower, I mean, if we could work something, we would. We would work with that gentleman, but we have been unable to.
You haven't talked to him at all?
I've talked to him about, even a year or two ago. Yeah, it's been a long time.
Did he tell you what he wanted? Did he put a price on it?
No, he was not willing to sell. And so I think.
Or rent either.
Or rent.
If I may, sorry. It was maybe 3 or 4 weeks ago that I reached out trying to find him. And he's got, the only way you can do it is sleuthing to try to find out what an email is for him. I reached out, sent an email, did not get a response back. I found a number for him listed on an application. I called that application. The woman answered the phone. I told her who we were. She laughed at me and said, I'll send your information along. I did not hear anything back for another week. I then emailed him through a different email I found. And she responded, the same woman, and said, you spoke to me last week. I passed your information on. He'll get a hold of you if he wants to talk to you. That's how far we've gotten. So we've been exploring other options. This option is similar to what we're doing in other counties and cities. It's a fast, effective way to do what we need to do.
Yeah. Yeah, the only way, and I'll just finish with this, the only way I met with him before is I literally went out to the country club, and I walked around, and I went there a couple days, and I eventually ran into him. So, very hard to find. Going back, just to finish up on the price point, really, if I was to negotiate and I was really to start out at a bottom price, we'd go much lower. I mean, there's many occasions where we'll work with an elevator out in rural Kansas that says, we need it. We want this for our people. And talking to the wireless guys, they've done deals for $100, $150 per year, to get on the tower, just to get it out to those people. So when we come in and we say $200, $250, that's really starting at a premium, fair price point. Like Ethan said, we're not trying to pull anything over. We're starting at what we have defined as a fair price point to get moving on this project due to the timeline.
I think I think we understand where you're coming from. I think that part of our concern about, you call it price point, is that if somebody else asks to be on that tower, we've got to be appropriately. So I think there needs to be some investigation by the county of what this appropriate needs to be.
Will you reach all the Highlands?
We should be able to. The only variables that we can't say today would be something like a line of sight issue where maybe there's too many trees in the way. But we're going to do our due diligence to reach. We will have the radius over the Highlands, yes.
And if I may, my understanding is the 81 number I gave you, the premises, does not include the Highlands. This is outside.
Doesn't include the Highlands.
That's my understanding from talking with the person who's mapped out this radius.
Does Highlands already have service of some
I think
sort?
it'd be through that Crazy Communications if they have it. I don't know. I don't know the situation out there. But again, we were looking at people who don't have access right now, and that's the number that we came up with, this 81 premises that need the internet right now.
How many premises fall within in that entire area? If there's 81 that could use service, how many is there in all?
I have no idea on that exact number. I asked.
Do you have a rough estimate?
I have
Is
no
it hundreds?
I would doubt it. I don't know.
That's not including the Highlands. So are you going to, how much of the Highlands people, households, will you cover?
Well, it would cover it. I mean, if they wanted to access the IdeaTech, my understanding is they can get it.
Okay.
Yeah, this is not, I'm just saying as far as that number that I'm telling you, that's people that our engineers have determined that's the radius. So
Yeah, I have no doubt in meeting with the city of Highlands when they created the city that as much as I want to be sure that water safety is controlled, that it would benefit the opportunity to build in the Highlands.
Well, but is it a redundant internet service? It sounds like they already have something.
Of the same quality and speed. Yeah, I hear where you're coming from,
Yeah,
Mark.
it's interesting.
right, well, that's, again, that's not including that's why when I say 81, I wasn't including the Highlands, because I know they may have access.
I would have personally thought you would have done some research with the Highland people.
I thought it was about the Highlands
That's what I did too.
until this moment.
We've met with the Highlands in the past. They have a desire for better quality of internet. Right now, the scope of what we're looking at is with CARES funding. We're looking for going out to the underserved people. Can we include the Highlands? Absolutely, we can. It's included in the scope. I mean, we have heard in the past there's a need and that they want to be involved in another option for internet. But right now, what we're coming today is with CARES money, and we need to reach out to the underserved of the Reno County area. And so that's what we're trying to push today.
So that's one of the requirements of CARES, of what I'm understanding you say. So any other?
Are these 81 people, they have no internet? Do they have other options? Or what happens?
So
just educate me a little bit
I'll do the best I can
81
for you.
people.
So how I understand it is the government has based a standard for internet bandwidth. It's got to be 25 meg. And these people would be under that value. They do not receive an internet capable of at least the standard of 25 meg.
Okay.
Through past experience, when talking to these people, they're trying to, they'll do a speed test. They can go to speedtest.net and they can run it and they can determine what speeds they're getting. And we're talking to people that are less than a meg sometimes. I mean, it's running and it says point, whatever. But sometimes there's more than a meg, sometimes there's 2, sometimes there's 5. It's not scalable. It's not what we want to see in Reno County, today. So like I said, what we're rolling out is a product that is a minimum of 25, but it's scalable up to 100. They can sign on and they can get 100 meg.
Okay.
Can I just interject here? We're talking about the county generating revenue, and I think Mr. Sellers correctly said it's not, any revenue does not come to Reno County. It goes to the water district, which is a separate quasi-municipal taxing entity. The county, I know it gets confusing because the county commission wears a number of hats as the governing body of various benefits districts. This is one of them. And I can tell you that I know that there were somewhere around 125 to 130 homes in the Highlands area when they were talking about creating the city of the third class. And I can tell you with respect to the water district that it merged with a water district originally known as Bonnie Bry, which essentially starts at the corner of 82nd and Hendricks. There's a subdivision over there as you go south from south on Hendricks from that particular intersection, and Water District 8, which is known as the Highlands Water District, was selling water to that Bonnie Bry for a number of years because there is no water source where they're located. And so after a number of years, those two water districts were merged. So in terms of the taxpayers who paid for the improvements out there, it's just not the residents of the Highland, it's also the people in that other water district, which if you went down Monroe Street, it takes you about 2 miles to get there, but as a crow flies, it's just across country. So that's just some information. And I suspect they might have something to say about, all those people might have something to say about using the water tower for that purpose. I'm sure we'll contact them and see how they feel about that.
Okay. So is the commission interested in asking the county councilor to work with these gentlemen from Idea Tech to bring us back a contract? I think that's the question today.
I would, and from my standpoint, I was kind of negative on it earlier. I want to make sure that the water safety quality is assured. But yes.
Okay.
The more we can do to get internet out there, and I'm not, I really was concerned at City of South Hutch, as I mentioned before, we never allowed anybody on the water towers. Just because of water safety, and condemnment doesn't do any good when you got a lot of.
Right, but I think it's been explained to us by having water officials at that site when they're there and compensated that we can take care of that issue.
And a contract would need to make sure that our expenses for having people there is compensated. But, yeah, this is a for-profit business, and there needs to be serious negotiations to make sure that y'all do your part to share the wealth with the water district, and I would look at it more like I'd take a flyer on like a 15% of your gross monthly on it. I'd do something like that. That's the way I'd look at it personally. But for me, it's going to be about the money, because it's going to be work, it's going to be expense, it's going to be risk, and ultimately, at the end of the day, you compensate all that risk and time and energy with money.
Agreed. So I'm behind here, and thank you for that comment, Commissioner Steven. Did you make a motion?
Well, I haven't yet.
Okay. Does anybody want to make a motion on this?
Well, I would, hadn't thought about it yet. I would move that we approve a request from Idea Tech to enter into a wireless attachment lease and with the water district in place of the county to attach certain wireless equipment on top of the Highlands Water Tower, contingent upon contract approval and presentation to the water, what are we officially? Water, anyway, to the commission.
Would you word it, say enter into a contract or further negotiate?
No, there's a consensus on the board that if what you're telling me is that you want the county councilor to
enter in
contract lease discussions with with Idea Tech, and I understand that, and I don't know that
to
there's a
present
formal motion, but I hear a consensus from you, and I can do that.
To present to the commission, along with the exchange with the water.
If you didn't need a motion, I wouldn't bother.
Okay, so we're not going to accept your motion, Ron.
All that work? I'm fine with that, okay?
Thank you, Joe, for one-time simplifying things for us.
Don't count on it.
Don't count on it again? Okay. Okay.
Thank you.
Moving on. Thank you, gentlemen, for being here, and we'll try to do this as swiftly as possible. Next item is there's a request to visit with county clerk and our election commissioner regarding elections, our last election. Commissioner Steffen, would you like to ask the questions that you have?
Well, I didn't really have a question. I think the thing kind of grew on me. I did a poor job of wording it in the email to you. I just wanted a memorialization of the canvassing and where you kind of chaired it. I think you're best to do it, and basically talk about how smoothly it went and what a nice job they did and how it proceeded.
How it worked, how the whole process worked here in Reno County, kind of, and why.
Well, just, yeah. just the smooth nature of it, and how it proceeded without any problem whatsoever.
Donna, you can help me out when I err, as counselor has. Essentially, a few years ago, we spent approximately $600,000 for new machines, and they were both paper and computer-oriented,
Touchscreen.
electronic-oriented, to where they could consense that.
What brand are they?
Dominion.
Oh.
That's already been addressed many times, and all of that has been, that's all been, they've had numerous, and I think Randy sent you the email. They've done numerous reports on it, and everything that they have stated is false. So there's no proof that it switched any of the
Well, and I'll buy that statement that there isn't any proof that they're able to manipulate it, but from there, yeah.
Well,
But anyway,
I can guarantee
I really didn't want to go there. That was never my point.
But I can guarantee you this is not manipulated in Reno County. Jenna does all of our programming in-house, and we did an audit, and it came out exact. So I can stand in front of you, and I can guarantee you that our numbers are.
And that was never part of my intent.
I didn't think it was,
I don't even
Mark.
want to go there. I'll get them back away.
But one of the things that I inquired early on was, and Jenna and Donna answered this, is I questioned the stamps, date stamps on the ballots that were sent in by mail, because I know there's a possibility that if you have a postage meter, that you can change the dates on those to comply. From that standpoint, in Reno County, everything is postaged, return postage is put on the return ballots. That was a question I had. And so they will only accept a USPS stamp or a FedEx or a similar company that handles mail. They won't accept any other type of stamps. And when it goes in, they check for people that may have died. They check for the autograph. And so from that standpoint, when I said very smoothly, is that was all done in that week in between. And so that's kind of what I was meaning by that. But I did have a concern over that, and they answered that, which made me feel a lot easier. And so that information, the work that they've done ahead of time to make sure that the ballots were correct, and that's my problem, making sure that they were correct. And so that's why I meant by how smooth and easy it was for the canvassing part. I hope that helped, answered some of that.
Very good. And from there, we proceeded with the canvassing. They had a nice diagram, so to speak, showing the types of ballots, showing the Kansas statute that validated it. We had 100% agreement on every bit of it, and it went very, very smoothly.
Thank you. We try hard. The girls have put in a lot of hours, but we all have put in a lot of hours, and it takes a lot of hours to check each one of those, because each one of those provisional ballots have to be, envelopes have to be touched individually to see what's going on with them, so.
So we didn't get a chance to talk much about that before the time, but.
Well, I thought it was important for it to be heard that the county commissioners, by Kansas statute dating back to the 60s, are mandated with the task of serving as the canvassers, and that it went smoothly and without a hitch. And I don't need to go any deeper into it than that. Yeah.
Thank you.
Thank you.
Thanks, Donna. I'd like to thank you and Jenna. My 2 years here on the commission and going through several area elections in the county and all, I've seen nothing but very professionalism by your staff, and I just think in this one case or certain case that an elected official is doing their job 100% and has staff that's very competent in this issue.
Thank you. I appreciate that.
Okay, item C, there's a request to consider a motion on Health Order 20-4. I think that request was for Commissioner Steffen, so I'll let you have the floor.
Well, I appreciate that. I do think it's important that we vote on it, particularly in light of the fact that it was presented to me 12 hours before we're voting on it. And whereas I am a medical doctor and was not sought any input into it whatsoever, nor any of the other physicians that we had recently extended an offer to use. Again, I'm incredibly concerned with the fact that it's an echo chamber now, and that starts at the state level, and it courses its way to the county level, and we just continue to double down on concepts that really aren't founded in fact or results or science, and I know they're doing the very best they can. You know, it ultimately, at the end of the day, it kind of serves to prove Einstein's definition of insanity, doing the same thing over and over, expecting a different result. So I do think it's very important that we go on record having voted for this, particularly in that it will cause an incredible uproar if an unelected official signs this into effect without any vote by the commissioners. And that, I don't think she deserves that, and I don't think she wants that. So I think it's our responsibility as commissioners to vote on this.
Okay, now, Joe, help me with this, is as commissioners, we do not approve a health order, but we have the ability to reject a health order. So with what Commissioner Steffen just said, if there was a motion to be made, it's a motion to reject the health order. It's not a motion to approve the health order, correct? Am I correct?
That's right. The local health officer has the authority to independently issue the order. You have the statutory authority recently given to county commissioners by House Bill 2016, passed in the spring, to override the health order. And so that would suggest to me that there is some indirect approval involved, and that it's not necessary for you to prove it for it to go into effect. But if the majority of this county commission does not want that to happen, then you should identify your objections to it, whether it's in totality or whether it's in part, and you can come back with your own order, if you will, overriding hers in whatever respect you decide is necessary.
I have, go ahead if you got.
Go ahead.
I would like to ask Karen to come up and ask one question, if I may, Commissioner Sellers.
Sure.
Would you agree to include in the first paragraph or somewhere within the proper order to sunset this health order on December 17th at 11:59 p.m.?
Yeah, so what I'm understanding you saying is that you want us to review it on the 17th of December, and to look at the data again, so we're reviewing it. Is that what you're stating?
Well, let's make it a date here before December 17th, okay?
But that would be a Thursday, the way we're going, I think.
Well,
I think what you're saying is you would like for it to expire on that date unless extended.
Yes,
Is that what you're looking
that's
at?
just what I'm looking at, yes.
And so if you came back 4 weeks from today, 28 days, which would be a Tuesday.
That'd be December 15th.
I think so. I'm not a math major, but that's pretty close.
Well, I got a little map right here.
I'll go for that. Karen, if she wants this to, she doesn't have to do anything. If she doesn't, it expires on its own terms. If she wants it to be extended, then she comes back with a proposal on the 15th.
Yes,
if you will,
is that okay?
To extend it for an additional term or whatever other modification she believes is appropriate.
I would like to at least come back on December 15th for your review of the health order.
I could make that concession, yes.
Okay, that's all I'm asking, really.
Well, Pat, I think it'd be a good idea if it goes out 30 days, that you meet 2 days in advance to give, enough time to make changes or implement.
Yeah, that's okay. Thank you. That's all I had.
Well, with what I heard, it sounds to me like I would need to make a motion that we override Health Order number 20-04.
Okay, there's a motion on the floor to override Health Order 20-04.
Made by Commissioner Stefan, please.
Yeah.
Is there a second to that motion?
I will second it, and I will second it because I feel every motion that comes before the commission needs a second so any discussion can take place.
You've stated that many times.
I'm doing it again.
Okay, so there's a second to this motion of overriding the health order by Commissioner Hurst. Now that there's a second, there can be discussion on this motion.
Well, it's extensive. Even in the first paragraph, you use the phrase "to mitigate the spread," first sentence, like it's guaranteed that that's what's going to happen, and that's not the case. You can't say that with that kind of certainty. And then the third paragraph, local health officer is appointed by the Board of County Commissioners. That's true. She was not appointed by me. And so that's a little bit of an issue because it's kind of a passive approval from me that I'm uncomfortable with. And in paragraph 4, we start talking about the wearing of masks or other face coverings. And it goes through the whole document talking about that as really even a primary way of controlling the spread. And that is a narrative that is being pushed strongly and being widely accepted. It's just not true, and it's not going to pan out over time, and I can't put my name on that, and I won't put my name on that. So, it'd take an incredible amount of adjusting to purge it of a lot of that verbiage. And then, I think whereas number 7, we get into it says the Reno County Commissioners seek to assess the business of being prosperous, which, that paragraph alone is okay, but collectively with the rest of the document, it creates this concept that the Reno County Commissioners buy into everything within the document, and I do not do that, nor do I believe the majority of the citizens of Reno County buy into it either. Again, it's just this false narrative that's not borne out by science. And I want to see this controlled as much as anybody else. But we heard these comments today. Take some kind of action. We have to stop this. Those are just emotional pleas, and I don't respond to emotional pleas by doing something that doesn't make sense. And we're better than that. And we've seen this virus for many months. We know a lot about it, and we've not adapted our approach to it at all. And we continue to fall farther and farther behind. I do think we had some very good discussion today. And again, if I can do nothing over the next 2 months, I do want to break this echo chamber and bring other viewpoints into the discussion as you make health orders. And I'm just dumbfounded that you have a medical doctor with 31 years of experience and all kinds of business experience, and you don't even let them know until 12 hours before you present this in public. That's incredible. And basically, I don't know how you move past that.
Additional comments, Commissioner Stefan?
Nope, thank you.
Oh, I'm sorry. Apologize. Commissioner Hurst, do you have any comments?
I appreciate your comments, Commissioner Stefan. I will be in favor of this health order. And I realize that, and I brought this subject up before, I don't want to know about these things the day before. But, and I can't speak to it with the same reference that you can. Because I'm just an old farm kid. But I think there's enough in this with the exceptions, and I think we need to look at the exceptions on this too quite well, because it protects not only, it allows business to go about business, it allows churches to go about churches, it allows facilities to be utilized, and it gives the businesses and facilities and churches the opportunity, rather than being against them, I think it gives them the opportunity to do what we need to do as far as economics are concerned. And I brought this up before. I will never support any type of shutdowns. So from that aspect, I think it's something we can do now. I will want to look at it in 30 days, and I may change my mind in 30 days.
Is that all your comments,
So,
Commissioner Hirsch?
all I care to make.
Okay. I have a few comments. I'm in support of the health order. We have more cases in Reno County than ever. We have more Reno County deaths recently than ever. I do think that the facts show that most people that are going to die from this are population 70 and over, and that's what the statistics show. And I think we need to do things that can help them not die. I think our hospital and medical community is overloaded, and they see no let up in sight. I do think that we're not just being an echo chamber. I think that from February and March on, we've listened to people that are experts in these fields. We've listened to our hospital and been working with them, with Chuck Welch with the hospital on an ongoing basis. And so I do think that we've been listening to experts in the field. Somebody referred me to an article in the Wall Street Journal, and they suggested that maybe the best solution for COVID is what they call the Swiss cheese effect. And imagine a piece of Swiss cheese that's 4x4 and it's got a bunch of holes over here. In my opinion, if you layer several pieces of those cheese together, you might have a solid that gives you some type of protection. Masks by themselves are not 100% effective. I do differ with others on this commission. I do feel like the science says that masks do have some ability to restrict the flow of the virus. I think social distancing and hand washing is important. And I think that limiting groups of 10 or less is important. That's another piece of this sliced cheese, that if we're to layer 3 or 4 things together, that we make a better difference for our community. Just a quote from another community from Johnson County yesterday from their medical people. Does the significant increases in cases mean that mask mandate is not working? It says masks work. Johnson County is not seeing increases in places where masks are being used. Schools and personal services businesses are excellent examples. When safety precautions are put in place, spread is minimal. When masks are not used, especially with individuals in close contact, such as private and public parties, restaurants, and bars, COVID is spread and cannot be controlled. And that's a statement from Johnson County, one, I believe, our second biggest county.
Who in Johnson County?
I'll get you the reference.
Those are anecdotes, which we talked about earlier.
Well, in your mind, they're anecdotes, but I think I'm allowed to believe what I believe. You're allowed to believe what you believe, but I don't think it's appropriate to question what I believe.
Oh, I disagree. I think this is a group of people who are trying to reach a consensus, and if we don't have some interaction as to how our thoughts are developed and moved ahead, we leave a lot on the table. You know, you just disregarded all the scientific articles and read us a couple of anecdotes that you don't even know who wrote it. So I think that I would be remiss just to sit and accept that. And so I strongly disagree with your concept that any of us are above questioning. We're not. We're clearly not. We're just employees.
I would want to, if I may, Commissioner Sellers, this order form does not totally restrict or prohibit gatherings or events that include more than 10 people. What it does, it relates the amount of people to a facility or to a room depending upon the 6-foot diameter. And so to me, that was a key, that we don't restrict the amount of people, but we restrict how many can crowd into a place. And one thing, Dr. Steffen, Commissioner Steffen, is there are a lot of people within this county that were appointed even prior to my being on the commission. And so I accept those appointments from previous commissions. And so I just wanted to relate that issue
Okay, any more comments before we take vote? Okay, the motion was to reject the order, so if you want to reject the order, you vote aye. If you don't want to...
The motion was to override health order number 20-04.
Okay, thank you for that correction. Please call the roll.
Commissioner Hurst.
No.
Commissioner Steffen.
Yes.
Commissioner Sellers.
No. No. Motion fails.
Thank you for bringing that up, Dr. Steffen.
You're welcome.
We could have some discussion over it.
Okay, we'll move on now to the county administrator report. Mr. Partington.
All right, Commissioners, one of the first things is aging. I was going to have Barbara. She wanted to talk about RCAT, so if she's here, let me just a second.
Haven't you learned how to turn that thing off yet?
I can't either. I do the same thing.
You know, I got lectured last time because I left my phone out there. Or they didn't lecture me, they appreciated it. And my ringtone is a Wabash Cannonball, okay?
Oh.
And I had 3 or 4 phone calls out there that I haven't.
I apologize. I turned this off always before the meeting, and with the prayer, I did not. I apologize for those interruptions.
No problem.
Okay.
Good morning.
Yes, good morning.
I asked Randy if I could have a few moments of his time. I wanted to update you on some of the things that we're hoping to do at RCAT. COVID has touched us in several different ways, and our community as well, and it is our responsibility to be able to provide continuous and reliable service. Excuse me. And with that, we would like to move to changing our hours slightly. we intend to operate from 7 to 4 daily and 9 to 2 on Saturday. That cuts off 2 hours of service on Monday through Friday. And the reason I want to do that is so that we can assure that we have enough drivers to operate the buses. And we designed a plan back in March that would give us cut points for decisions to change levels of service. And some of it has held, and a lot of it we have continued to learn through this process. What we really didn't anticipate were the number of people that would be kind of indirectly touched by COVID and the quarantines that have gone into place, and also the number of parents that might be obligated to be home with children. So given that, we need to plan so that we will have enough staff to operate the buses. And so that is our intention. We wanted to be able to begin this on the 23rd of November and to continue that through somewhat indefinitely, but we'll see how things go within the community. The good thing is that because we are a grantee of the FTA through KDOT, our costs will be covered at this time, and so our staff will not suffer. So I wanted to bring this to you to tell you what our intention was and why. And so we intend to stand down staff that we don't need. So daily we would have 4 drivers who would be working 8 to 5. We would have other staff who are in the building cleaning the buses, and then we would have some staff that were at home preserving their health. And then we would probably have some staff that are on sick leave and on quarantine. And so it'll be a little bit of a juggling act, but again, we want to do that so that we can continue to provide essential services for people who have no other transportation except RCAT.
Okay. And Randy, you're in agreement with this request by
Yes, I am.
their department to do this?
I think it's, yes, a good way to try to help prevent the spread internally with staff and still provide a service to the community.
Okay, thank you, Barbara.
You're welcome, thank you.
Any questions of Barbara? Thank you for being here.
Thank you.
Randy, will you continue with your items?
Yes. I wanted to mention the health department and working with Megan over at the health department and some CARES Act Sparks money and grants that the health department has. One of the items that they've looked into to help with community testing is a mobile bus unit. They've been in contact with Collins Bus about getting a mobile unit by the end of this year. We could use some of our Sparks money that the county has. Some of the health department has grants also. The mobile medical clinic would fulfill a need for the health department to accomplish community testings for COVID. And then it would provide a mobile unit with refrigeration, storage, and a restroom facility for staff to take on site and have all the items needed to test for COVID-19 and provide a safe space for staff. This unit will provide needed access to our rural, Amish, and lower social economic communities and areas, allowing for the ability to take COVID-19 vaccinations into the community equipped with refrigeration and power to plug in multiple coolers to store vaccination. The unit will allow for communications such as internet connectivity, mobile desk to run insurance, and a space and connectivity to input data electronically. Provide a private space for a provider, whether that's a nurse, mid-level, or an MD, to see a patient who may need to be seen immediately instead of waiting to go to a clinic-based facility or location. I'm bringing this up to you kind of preliminary. There wouldn't be there's not a lot of time before they would need an answer, but it would be some Sparks money. So I wanted to see if the county commission has a consensus or a general thought on whether to go forward with this.
Randy, I'm not in favor of that direction at this point in time. I think Commissioner Stephan brought up a very, very valid concern of a lot of Reno Countyans, and that is in the health and welfare. You brought this up at our last meetings about the health and welfare of the state fair. Early on, at your advice, we selected John Deerdoff and Gary Mager to work with the COVID funds that we had, 12.8 million?
12.6.
12.6, I overstated that. We did better than most counties in sharing this money with the various partners that we have. The educational community, I think we did a phenomenal job with. We gave some money to small businesses, and I think if there's any legal way that we can, the remaining monies that we're going to have, and you keep telling me we're going to have a number of that, what that number is soon, I think we should try to direct towards the state fair. I think they're in a terrible situation, and I think if we can legally use these remaining COVID funds for that source, that's a higher priority than this van.
I guess my question to that would be, if it's other grant money that the health department has, that's part of their CARES Act money, not the 12.6 million, would you still have that same thought of not going that direction, or does that change anything? If they can work around with their numbers, the cost is $175,000, so it's not cheap. That is a lot of money. It would be with their other grant money, if it's not the Sparks money. The Sparks money was one option, but I'm asking.
I think you're giving me some facts that I was not aware of. You're saying the health department itself, not related to the funds that we dispersed,
right?
They
also got some CARES Act money that went straight to health departments. That's not part of what the 12.6 that the county commission dispersed.
And am I assuming if we don't spend it, we lose it?
There's other things to spend it on. It's kind of like the Sparks money. Yes, we'll have to spend it or we lose it, but there are plenty of options to spend the money on. This is just one of the ones that the health department was wanting to do for help with community testing, and then next year vaccinations to reach the other parts of the county that's not just right and proper Hutchinson. But Commissioner, the source of money, because there are different pots of money, we weren't sure which ones to use. But before even completely determining that, I wanted to see if the commission was even on board with this, because it does have, it is a large purchase that has to be approved by the commission, and it does have long-term effects. We have insurance, we have to have storage. There's other things than just buying a van or bus and driving it around. Sustainability.
What do other commissioners feel?
I see it as a growth in government. I have a huge problem with that statement. If we don't use it, we lose it. That represents everything bad in government, and I don't think we truly know what we need in respect. And I know there'll be a huge percentage of my constituency will say, we got a pandemic and the county health department got a shiny new bus. So I don't see it.
I want a little more thoroughness. What's the use after post-pandemic? What's the lifetime depreciation on this? What is the maintenance cost? Storage cost, like you mentioned earlier. It's going to probably, and this is just my estimate, it's somewhere between $1.50 and $2 a mile just to run it up and down the road. How are these going to be all paid for? And that's without labor. That's just to run it up and down the road. But a lot of this hinges on the post-pandemic use. Is there something? What?
Commissioners, one of the things in talking with Megan would probably be flu shots and other health services that they provide. It would be going out still to the other communities.
In my past experience doing financial analysis around different states, I have found that we use libraries a lot. They were glad to have us use the library and didn't cost us a thing. And so there's probably facilities out there that could be utilized, and I just need a lot more information. I need a cost analysis and a benefit analysis. I guess that's where I'm at.
I think you're hearing, Randy, that the commissioners are not overwhelmed with the desire to do this.
Right, I get that message, so thank you on that. Okay, my next item is, I wanted, and we can do this at another meeting also, I just wanted to bring the legislative priorities, a discussion, kind of as governance for the county commission to start thinking about for the 2021 legislative session for the state and then the federal government. I handed out just kind of the Kansas Associations of Counties proposed 2021 policy statement. I don't see their adopted one out on the website yet. That's why this is just the proposed.
I think it's been voted on already.
It has, okay.
Yes.
And the document we have is the one that they voted on?
Yes, should be. I didn't read it yet, but 2021 policy, yes. I believe it has been.
Okay, so there's a lot of good information from the KAC. So I didn't really enter a lot of that information into this draft. I wanted to see which areas the county commission really wanted to prioritize on. So last week I sent an email to all the county directors, elected officials and appointed, to see what their state groups or what they're hearing from their counterparts. And so that's where I have one for community corrections, the district attorney, and then the appraiser is going to be getting me something. That's why there's some draft in here. The community corrections, of course, they're worried with the state budget, with the pandemic, and where things are going about making sure that community corrections continues to be funded. And district attorney had mentioned that there's some legislation to modify the speedy trial statute. He's going to get me more information on this. So again, this is just draft of what they emailed to me. I put in their property taxes. I know that in the past, earlier this year, the county commission had numerous discussions about this. The current tax lid has been in effect for a few years. KAC, puts in there, supports the repeal of the tax lid. I wanted to see if the county commission wanted to put that in there. I added some other language on the second paragraph, knowing that the state of Kansas, I think Senator Tyson is usually the one that's behind the Transparency Act bill. I forget the number of that tax bill, what it was for 2020, but there's some concerns that we discussed about the logistics of that. It's not about the transparency. The county commission, I think, believes fully in transparency of the tax lids and taxes and the impact to the taxpayer. It's just some of that bill's logistics they were going to make it very difficult for us to actually get a realistic number by the county clerk's office in the time frame. So I put in here that it'd be great for the legislators to have meaningful conversations with cities and counties representatives to know that logistics before they pass a bill.
And for your benefit, duly elected Senator Stephan, that was an unfunded mandate from the state.
Yeah, I'm pretty familiar with it. It's pretty interesting.
I bet.
Pretty interesting. And I'm familiar with the transparency part of it too. So you know how to get hold of me.
But I wanted to kind of open this up. Any discussions on this, or what's the direction you want me to take with a draft policy? Anything you want me to add, take out, or include?
The only thing I would suggest is we set up a meeting sometime in December with our legislators and senators, with the commission setting up, so we can discuss these items, and that'll give us enough time to work on different things and set up a time sometime in December before they go to legislature.
Okay.
And with the property taxes, the good thing is, you've seen that transparency bill that was passed by the House and the Senate. So you should be able to give some very clear cut ideas on what you'd like to see different.
Right, there were just some problems I saw with it that I could
Particularly,
easily
yeah, if
explain
it's
to
a
you.
timing issue, I'm sure people would be receptive towards trying to figure out how to make it functional.
Yeah, okay.
Well, and if we do meet with area legislators, I guess I'd like to have a 10-minute discussion on what the reality of the tax lid is, because I'm not a tax expert, but I see that if we decrease taxes next year, that hurts our ability to maybe fund what is needed down the line. And
Yes.
from my meager understanding of this, it seems like to me that their intentions are good, but what they're really doing is making us create budgets that might be overfunded for fear of underfunding our departments in the future. I didn't.
Pretty good
Does that
summary.
make sense at all, Doc?
But it doesn't, I thought, and maybe I don't, maybe I understand it even less than you do.
We'll agree that we both don't
Yeah,
understand it.
not completely for sure, but it sounded to me like what they're really doing is capping your ability to raise property taxes to inflation, right?
Yes, but the part that hurts us is, it's a how many year?
I think it's three-year average.
3-year average. And let me give you an
Taxes
example
Three-year average.
of how
It's not
I.
a roll, not a yearly, it's not based on the
No.
year before,
So-
it's based
So
on
if you lose a
inflation the
year-
last 3
Okay,
years,
so let's say if,
which has been flat.
let's say if our mill levy and is 10 for this year, and the county commission feels with due diligence on department heads and something like that, we can change the mill levy to 8 for the following year. What that does is creates an average of 18 or 9 instead of being at 10. So if the next year we have some important things that need to be done within the county, does this, that we can't move up beyond that 9, the 9 is our average then. And it seems to me, and again, I'd like to be better educated on this, that by the fact of this average thing, we can't be diligent each year for fear of what we don't know in the future. Does that make just a little
Well,
sense?
it kind of makes you just want to take your, go max.
Yeah, we're, sitting here, we're not gonna underfund for the next year, is what that does.
Interesting.
Yeah, and that average, Commissioner Stefan, it is not the average for inflation, it's, as Commissioner Sellers mentioned, it's the average for the tax levy. The
Okay.
3-year average
Okay.
tax levy,
Well,
then the new inflation rate, which I think for 2021 was 1.8%.
CPI, isn't it?
Yeah, they.
3-year average plus
And-
the inflation.
Right.
And I guess the reason I'd like you to consider this and our thoughts on this is that a lot of people you represent are very against tax increases and want taxes to be as minimal as possible. It seems to me that this is doing actually the opposite. And now, if you vote in county commissioners that are just going to spend to the limit, that's a different thing. But I don't think that's occurred, at least in Reno County.
I absolutely appreciate the difficulties of funding counties. I think it's the single hardest governmental task out there. So I feel your pain.
Okay, other things, Randy?
That's
Okay,
all-
we
that's all I
really
have.
didn't.
Oh,
Do we want to discuss this document at the next meeting?
I think at the next meeting. I would prefer to have it at the next meeting. We get a chance to, we've had a chance to look at it already. I haven't, okay?
oh,
Yeah.
And you're
okay.
just talking the one page or the
That's just what I had so far in draft, because I didn't know if the county commission is wanting a multi-page, large document, because I don't think they've had one in the past, or what would be most convenient for legislators also, so that may be a good question for you.
Well,
Well,
What
don't
would you
pull it
rather
short,
have?
throw all you want at us. I can digest a lot, don't be afraid to throw a lot at us, doesn't mean we'll do any of it.
I think we'll probably look at this and get some highlights.
Yeah.
Some really specific things that affect Reno County.
Yeah, I don't know, I think the more bullet points you introduce me to, the more I can latch on to as a progressive.
Okay.
Okay.
All right, that's all
Within
I have.
reason.
Randy,
don't
as far
highlight
as
that.
your comments there, when will we have this number that is the surplus of our COVID money? You've told me here it'll be next week, and are you telling me now it's going to be next week? Or because, as I just indicated, and I can make some remarks on my time, but I think there's a good place that maybe this could go to.
Right, Commissioner. What is causing the problem is getting the numbers back from some of the other entities of what they have left, what they're not able to spend. And the numbers, there's been some questions on delivery dates, so that has impacted whether those expenses qualify, or the money's going to come back to the county, which then would go back to the state or up to the commission. So I believe the 19th was another date that Leslie, John, and Gary had given to school districts in the cities to have a number by.
Okay, which
So
is
we're
Thursday.
we are hoping, and I know there's been some emails this morning between Gary, John, and Leslie trying to communicate with some of those entities to work with them individually to find out what's the holdup, where are the numbers, so if there's an issue like the state fair, that the county commission has a number to go to the state with.
But you don't have even a number at all to give us today.
No, I could give a number, but if it was wrong,
Okay, better not. But since they're given that 19th deadline, I guess I'd like to suggest that we have a report on that by Gary or John next week to see what monies are left. Okay, Commissioner Stefan, do you have comments tonight?
Quickly, I do remain concerned about the narrow field of view that we have with this virus. The collateral damage tends to be what's overlooked. Excuse me. That's our compromised education, drug addiction, spousal abuse, suicide, and untreated medical conditions is just a portion of them. And out of respect for this collateral damage and as an act of good faith to the community, I have decided to donate every penny I get while I serve as the interim county commissioner, and I'm going to donate that money to Bright House, Prairie Star Health Center, and Open Door Pregnancy, out of respect for each of those agencies and those who are getting pulled down by the collateral damage. So just an FYI, and I certainly challenge and welcome you all to do that same in December as a Christmas gift to those entities.
Is that the extent of your comments?
Yeah.
Okay. Commissioner Hurst, comments?
I spent a lot of time with people that have called me and emailed me, and I've spent a lot of time talking to the man upstairs, trying to decide how to approach things, and I would just encourage everyone to spend some time in prayer for their decisions and their thoughts and how they handle things, and include those who are suffering. That's all I have.
Okay, I think I only have one item, and I've already talked about that, but I asked our county administrator for an update on how we might be able to pass some funds to the state fair, and he suggested it might be more appropriate for the state fair to tell us how that might be, since they've got abilities to talk to people at the state level that have a tendency to say, no, you can't do that. And so I've asked Ed Berger to, in fact, he told me he would be calling some people today to see how that might occur. Commissioner Stefan brought that up last week, and I think that if we can help the fair with some funds, I think that's a very legitimate purpose of some of these COVID funds. We do not want the state fair to go away, and we understand the problems that they have with not having a fair this year. So Any other items this morning? Joe, do you have anything for us?
No, sir.
Okay,
That's 2 quick responses today.
okay, yeah. You're wanting us to remember that, aren't
Yes.
you? Okay. I'll call this meeting adjourned. Thank you.
Thank you.
All right, then.